saya memutuskan untuk memberlakukan PPKM darurat sejak tanggal 3 Juli.
Terbaik dan yang membahagiakan, 60% wilayah Jawa Barat sekarang sudah PPKM level 3. Nah, PPKM level 4-nya tersisa hanya di aglomerasi Jabodetabek dan
Assalamualaikum warahmatullahi wabarakatuh. Hello, my name is Citra Pramudita.
Hello, my name is Ridwan Syahmual Dasar. We are alumni of Stika PPNI Jawa Barat 2020.
And we are a nurse.
We are currently working in an isolation room for COVID-19 patients.
Transformations and innovations are needed for today's conditions.
Only those who are adept to the circumstance are able to survive.
Of course, the cooperation is needed to end all this. It's not only about us, but also our family and the people around us. Let's stop the spread of this virus together while maintaining health protocols. Stay safe and keep healthy. Together, we can. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Bisa merebut senyumku, tapi sungguh tak akan lama. Kau bisa merobek hatiku, tapi aku tahu obatnya. Manusia kuat, itu kita. Jiwa-jiwa yang kuat, itu kita. Manusia kuat, itu kita. Jiwa-jiwa yang kuat, itu kita. Kau bisa hitamkan putihku, kau takkan gelapkan apapun. Kau bisa runtuhkan jalanku, kan ku temukan jalan yang lain. Manusia kuat, itu kita. Jiwa-jiwa yang kuat, itu kita. Kau bisa patahkan kakiku, patah tanganku, rebut senyumku, hitamkan putihnya hatiku, tapi tidak mimpi-mimpiku.
Namaku Dita, aku kuliah di Stika PPNI Jabar semester 1. Kampusnya sangat strategis, dekat kemana-mana. Stika PPNI adalah tempat pas bagi mimpiku jadi perawat. Di sini, aku belajar dari dosen-dosen yang profesional. Peralatan lebih yang lengkap, juga kesempatan praktek langsung di rumah sakit ternama. Mahasiswa-mahasiswi Stikap sangat bersahabat. Aku biasa ngerjain tugas barengan sambil ngobrol. Kenyamanan belajar penting banget bagi aku karena kuliah bukan hanya soal tugas dan ujian, tapi bertumbuh bareng dalam persahabatan. Disinilah aku memulai karir masa depanku. Karena kampus ini mengajarkan aku bahwa menyelamatkan nyawa seorang manusia adalah tugas seorang pahlawan. Tapi menyelamatkan ratusan nyawa itu baru tugas perawan.
perkenalkan nama saya Evi Karlina. Saya anggota PKM Kewirausahaan dengan produk MAM.
Perkenalkan, saya Selina Selina dari Prodi S1 STIK PPN Jawa Barat. Saya anggota PKM Kewirausahaan dengan produk MAM.
Halo, perkenalkan saya Arifin Nur Alam, saya dari Prodi D3 Keperawatan. Saya anggota dari PKM Kewirausahaan MAM.
Perkenalkan, nama saya Santi Rizky dari Prodi D3 STIK PPNI Jawa Barat. Saya anggota PKM Kewirausahaan dengan produk MAM.
Halo, perkenalkan, nama saya Putri Oktavia Hasim dari Prodi S1 Sekolah Tinggi Ilmu Keperawatan PPNI Jawa Barat. Saya sebagai Ketua PKM Kewirausahaan dengan produk MAM, Monopterus albus meatball. MAM sendiri adalah suatu produk inovasi bakso dengan berbahan utama belut lokal yang mempunyai kandungan protein hewani baik untuk pasien hemodialisa yang tentunya dapat dinikmati oleh masyarakat umum. MAM bercita rasa tinggi, produk lokal dalam negeri.
Sebagian besar pasien yang menjalani hemodialisa mengalami kesulitan dalam mengikuti diet yang direkomendasikan. Hasil penelitian menunjukkan bahwa asupan protein pasien tersebut sulit dipenuhi dikarenakan terjadi perubahan nafsu makan dan seringkali rasa makanan dari lauk hewani kurang sesuai dengan selera makan pasien. Belut atau Monopterus albus merupakan salah satu sumber protein hewani yang bernilai biologi tinggi. Sedangkan bakso saat ini menjadi makanan favorit di berbagai kalangan masyarakat Indonesia. Kami hadir mengkombinasikan keduanya menjadi makanan yang menyehatkan dengan cita rasa Nusantara. MAM, Monopterus albus meatball.
Hai teman-teman, selamat datang di Mosog Official. Alhamdulillah, pada tahun ini tim kami diberikan kesempatan oleh Dikti untuk menjalankan program kreativitas mahasiswa tahun 2021 dengan judul yang kami usulkan yaitu Soft Gel Ekstrak Mole untuk meringankan osteoporosis di bidang PKM Kewirausahaan. Sebelumnya, izinkan saya memperkenalkan dosen pendamping tim kami, yaitu Nurse Diwa Agus Sudrajat MKep. Dan perkenalkan, nama saya Karina Septiani, selaku ketua tim dari Prodi S1 Keperawatan. Adapun anggota tim saya, yaitu yang pertama ada Indri Irmanianti dari Prodi S1 Keperawatan. Selain itu, ada pula Naufa Ulfa Khairiyah dari Prodi S1 Keperawatan. Selain Naufa, ada juga Nita Kartini dari Prodi S1 Keperawatan. Dan anggota tim saya yang terakhir yaitu Erika Putri Firdaus dari program D3 Keperawatan. Dan inilah kami, tim PKMK dari STIK PPNI Jawa Barat. Di sini kami menciptakan produk yang bernama Mosog. Mosog adalah mole soft gel. Mole sendiri artinya yaitu moringa leaf yang sering dikenal oleh masyarakat yaitu dengan sebutan daun kelor. Dan di sini kami akan membuat suatu produk yang berbahan utama daun kelor yang diolah untuk menjadikannya sebagai suplemen ataupun kudapan yang dapat meringankan osteoporosis terutama pada lansia. Karena yang kita ketahui bahwa daun kelor ini memiliki banyak manfaat, terutama dalam salah satunya yaitu kalsium dan juga mineral. Dan ini adalah gambaran kemasan dari produk yang akan kami buat. Di sini kami menggunakan kemasan yang aman tentunya dan juga ramah untuk lingkungan. Nah, tadi adalah sedikit penjelasan mengenai Mosog. Untuk teman-teman yang masih penasaran dengan info lebih lanjutnya, boleh follow Instagram kami @mosog_official dan jangan lupa untuk share ke teman-temannya. Ditunggu ya. Bye.
Halo teman-teman, Assalamualaikum warahmatullahi wabarakatuh. Perkenalkan, kami dari tim PKMPM Stikep PPNI Jawa Barat.
The rest don't matter, yeah, the pain could peel, the glass could shatter, let it rain, 'cause you and I remain the same. When there ain't a crack in the foundation, baby, I know in a storm we're facing will blow right over while we stay put. The house don't fall when the bones are good. Work, but you gotta put in work, 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 work. You don't gotta go to work, 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 work. Let my body do the work, 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 work. Jadi mandi lagi, dingin, dimandiin, masih masuk tepuk tangan.
Seperti apa sih? Kita simak baik-baik ya. Nah, teman-teman tahu kan ini adalah penjumlahan menurun. Penjumlahan menurun ketika dijabarkan puluhan dan satuannya akan seperti ini.
Baca. Untuk itu,
pertama, kita akan menjelaskan tentang tanda baca koma. Jika saat membaca bertemu tanda baca koma, maka pembaca berhenti membaca sebentar. Lalu dilanjutkan kembali.
The rest don't matter, yeah, the pain could peel, the glass could shatter, let it rain, 'cause you and I remain the same. When there ain't
MRSA merupakan program kreativitas mahasiswa riset sosial humaniora yang mengungkap hubungan sebab akibat penelitian deskriptif tentang perilaku ekonomi, pendidikan, dan kesehatan. Fundamentalnya dari program kami dikarenakan penyebaran COVID-19 di Indonesia yang terutama pada tingkat akademik yang memberikan dampak positif dan negatif. Sehingga hadirlah collaborative class on virtual pandemic sebagai ide termodifikasi tujuan pada tingkat akademik sekolah menengah pertama. Tujuan dari riset kami adalah memberikan informasi dan inovasi sebagai metode belajar yang bervariatif untuk memicu kognitif dan daya ingat sehingga memahami dengan inovasi metode belajar yang baru.
Dalam alur pelaksanaan riset itu, yang pertama ada kognitif, yang kedua ada daya ingat, yang ketiga ada improvisasi. Dalam improvisasi, yang pertama ada flashback atau kognitif dan daya ingat, lalu yang kedua ada metode kolaboratif atau efisiensi waktu, lalu yang ketiga ada metode belajar atau pomodoro.
Kognitif sendiri merupakan suatu proses berpikir setiap individu dalam menghubungkan, menilai, dan mempertimbangkan setiap kejadian ataupun peristiwa. Bila kognitif baik, maka daya ingat pun akan meningkat sehingga dapat membantu siswa-siswi SMP dalam menghadapi pembelajaran di masa pandemik ini.
Virtual tugas, ada Google Documents, WhatsApp, dan Classroom. Metode virtual, ada Google Meeting, Google Zoom, dan Cisco WebEx.
Pada penelitian kolaboratif kelas on virtual pandemic ini juga, kami menggunakan metode brain gym atau senam otak yang digunakan untuk meningkatkan daya ingat siswa-siswi SMP yang sedang kami teliti.
Assalamualaikum warahmatullahi wabarakatuh. Selamat datang di Riva Corporation. Saya Aimar Dia sebagai Direktur Riva Corporation.
Saya Yusuf, General Manager Riva Corporation.
Perusahaan kami berdiri sejak tahun 2002 dan terus berkembang. Mulai sekarang kurang lebih ada 16 tahun. Dari mulai melayani hanya 40 mahasiswa dan sekarang sudah sekitar 500 mahasiswa yang kami layani. Dari mulai dulu hanya 2 asrama, sekarang sudah kurang lebih mencapai 10 asrama.
Fokus pelayanan kami adalah memberikan servis, memfasilitasi student di seluruh Indonesia dalam bidang dormitoris atau asrama. Pelayan-pelayan kami terdiri dari tenaga-tenaga muda yang energik dan profesional yang sudah dilatih Service Excellence. Sebagian lagi adalah tenaga-tenaga senior yang akan memberikan pelayanan secara penuh empati.
Tiga pilar dalam pembelajaran klinik. Yang pertama adalah rumah sakit, yang kedua adalah mahasiswa dari suatu institusi, dan yang ketiga adalah akomodasi. Tiga hal ini penting dalam pembelajaran.
Kami, Badan Eksekutif Mahasiswa Stiker PPNI Jabar, siap mengikuti International Conference in Nursing 2021.
Stiker PPNI Jabar,
cerdas, tangguh, profesional.
Kami dari Santosa Hospital Bandung Sentral siap mengikuti acara International Conference in Nursing yang akan diselenggarakan oleh
Stiker PPNI Jawa Barat, cerdas, tangguh, profesional. Terima kasih.
Pada hari ini, kami perawat yang bertugas di garda depan COVID-19 siap mengikuti acara International Conference Nursing di tahun 2021. Itu perawat Indonesia, Stiker PPNI, cerdas, tangguh, dan profesional.
Tiada kata untuk kami yang bersedia pandemi 19 COVID
saya memutuskan untuk memberlakukan PPKM darurat sejak tanggal 3 Juli.
Perbaikan yang membahagiakan, 60% wilayah Jawa Barat sekarang sudah PPKM level 3. Nah, PPKM level 4-nya tersisa hanya di aglomerasi Jabodetabek dan Banten.
Assalamualaikum warahmatullahi wabarakatuh. Hello, my name is Citra Pramudita.
Hello, my name is Ridwan Syahmuan Dasar. We are alumni of Stika PPNI Jawa Barat 2020.
And we are a nurse.
We are currently working in an isolation room for COVID-19 patients.
Transformations and innovations are needed for today's conditions.
Only those who are adept to the circumstance are able to survive.
Of course, the cooperation is needed to end all this. It's not only about us, but also our family and the people around us. Let's stop the spread of this virus together while maintaining health protocols. Stay safe and keep healthy. Together, we can. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Bisa merebut senyumku, tapi sungguh tak akan lama. Kau bisa merobek hatiku, tapi aku tahu obatnya. Manusia kuat, itu kita. Jiwa-jiwa yang kuat, itu kita. Manusia kuat, itu kita. Jiwa-jiwa yang kuat, itu kita. Kau bisa hitamkan putihku, kau takkan gelapkan apapun. Kau bisa runtuhkan jalanku, kan ku temukan jalan yang lain. Manusia kuat, itu kita. Jiwa-jiwa yang kuat, itu kita. Kau bisa patahkan kakiku, patah tanganku, rebut senyumku, hitamkan putihnya hatiku, tapi tidak mimpi-mimpiku.
Welcome to all participants in the 5th International Conference in Nursing held by Stika PPNI Jawa Barat in collaboration with Stikes Panakukang Makassar, Stikes Sukabumi, Universitas Lambung Mangkurat Banjarmasin, Poltekkes Karya Husada Yogyakarta,
Stikes Muhammadiyah Ciamis, Universitas Muhammadiyah Jakarta, Stikes Dirgahayu Samarinda, and sponsored by Riva Corporation.
Ladies and gentlemen, as this conference is about to begin, please be seated and be reminded to put your microphone into silent mode. Now, we are going to listen important notice.
Important notice.
Untuk perhatian,
All participants must use real name.
ID peserta dalam webinar ini harus menggunakan nama asli.
Participants should dress and behave appropriately during the event.
Peserta harus berpakaian dan berperilaku sopan saat webinar dilaksanakan.
Participants are expected to turn on the video and mute the microphone during the event.
Peserta sangat diharapkan untuk menampilkan video on, dan mematikan suara, mute, selama webinar berlangsung.
For discussion sessions, participants can ask the questions via chat room. Only some selected questions will be discussed.
Untuk sesi diskusi, peserta dapat menuliskan pertanyaan di kolom chat Zoom. Hanya beberapa pertanyaan terpilih yang akan didiskusikan.
The initial registration form will be distributed 15 minutes after the event starts and will be lasted for 45 minutes.
Form registrasi awal akan dibagikan 15 menit setelah acara dimulai dan akan aktif selama 45 menit.
Certificate will be provided only for participants who fulfilled all the requirements below.
Sertifikat akan dibagikan hanya kepada partisipan yang memenuhi syarat sebagai berikut.
Attended full schedule webinar.
Mengikuti webinar dari awal hingga akhir.
Like and subscribe Stika PPNI Jawa Barat YouTube channel.
Like dan subscribe channel YouTube Stika PPNI Jabar.
Filled out both the initial and evaluation registration form.
Mengisi form register awal dan form evaluasi. Ladies and gentlemen, kindly take your seat. The opening of the 5th International Conference in Nursing held by Stika PPNI Jawa Barat is going to start. Please be reminded to follow the important rule we have informed before. The Honorable and Distinguished Guest, Minister of State-Owned Enterprises, Mr. Erick Thohir, Chairman DPP PPNI, Dr. Hari Padilla SKP MH MKep, Chairman DPW PPNI Jawa Barat, Wawan Hernawan MKep, Koordinator LL Dikti Wilayah 4 Jabar Banten, Honorable Pembina, Pengawas, dan Pengurus Yayasan Perawat Nasional Indonesia Jawa Barat, Chairman of Stika PPNI Jawa Barat, Nurse Diwa Agus Sudrajat MKep, all invited speakers and participants. Assalamualaikum warahmatullahi wabarakatuh.
Excellencies, distinguished guests, delegates, ladies and gentlemen, good morning and welcome in the 5th International Conference in Nursing, Stika PPNI Jawa Barat 2021. I am Gilang Dwi Pratiwi.
And I am Masdum Ibrahim.
On behalf of the committee, it's our pleasure to be host on this beautiful morning. This event is an annual agenda held by Stika PPNI Jawa Barat. We had successfully held 4 conferences since 2017. There were International Conference on Disaster Management and Infection Control in 2017. International Conference on Healthcare and Management in 2018. International Conference on Healthcare Technology in 2019. International Virtual Conference in Nursing in 2020. And this time, during the pandemic COVID-19, Stika PPNI Jawa Barat keep carrying out the international conference through virtual method.
In this event, we have 6 speakers from 5 countries: Taiwan, Malaysia, Philippines, United Kingdom, and Indonesia. This event is held by Stikes PPNI Jawa Barat in collaboration with co-hosts, consists of Stikes Panakukang Makassar, Stikes Sukabumi, Universitas Lambung Mangkurat Banjarmasin, Poltekkes Karya Husada Yogyakarta, Universitas Muhammadiyah Jakarta, Stikes Muhammadiyah Ciamis, Stikes Dirgahayu Samarinda, and sponsored by Riva Corporation. As start of opening ceremony, we will hear Republik Indonesia anthem, Indonesia Raya.
Indonesia tanah airku, tanah tumpah darahku. Di sanalah aku berdiri, jadi pandu ibuku. Indonesia kebangsaanku, bangsa dan tanah airku. Marilah kita bersatu, Indonesia bersatu. Hiduplah tanahku, hiduplah negeriku, bangsaku, rakyatku semuanya. Bangunlah jiwanya, bangunlah badannya, untuk Indonesia Raya. Indonesia yang merdeka, merdeka, tanahku, negeriku yang ku cinta. Indonesia yang merdeka, merdeka, hiduplah Indonesia Raya. Indonesia yang merdeka, merdeka, tanahku, negeriku yang ku cinta. Indonesia yang merdeka, merdeka, hiduplah Indonesia Raya.
Distinguished guests, delegates, ladies and gentlemen, now we move to the opening remarks. To open this conference, please be invited the Chairman of Stikes PPNI Jawa Barat, Nurse Diwa Agus Sudrajat, Eskap Mkap. Mr. Diwa Agus Sudrajat, time and place is yours.
Assalamualaikum warahmatullahi wabarakatuh. Good morning and best wishes for all of us. The honorable and distinguished guests, Mr. Erick Thohir, Minister of Indonesian State-Owned Enterprise, Mr. Dr. Hari Padilla, Chairman of the DPP PPNI, Mr. Wawan Hernawan, Magister Keperawatan, the Head of the PPNI Jawa Barat, Management, Practice, and Inspector Staff of TNI Jawa Barat Foundation, all co-hosts who involved in IPCN event 2021 are University Muhammadiyah Jakarta, University Lambung Mangkurat Banjarmasin, Stikes Sukabumi, Stikes Panakukang Makassar, Stikes Muhammadiyah Ciamis, Stikes Dirgahayu Samarinda. All speakers are Professor Dr. Fadilah Muhammad, Postgraduate Nursing Study, Faculty of Nursing, Lincoln University College. Nursing Min Chen, PhD, RN, Associate Professor, Department of Nursing, College of Medical Medicine National Chengkung University. Profesor Nur Salam, Faculty of Nursing, Erlangga University. Dr. Maria Elizabeth, Program Coordinator Sinfo University. Theodore Stickley, PhD, MA, Division of Nursing, University of Nottingham. Winnie Hadiani, Head of Nursing Undergraduate Study Program, Stikes PPNI Jawa Barat. All my beloved colleagues and lecturer, staff of Stikes PPNI Jawa Barat, all presenters, all participants of conference, expertise, practitioner, and nursing observer. Ladies and gentlemen, in such a great and happy day, let's praise and thank to Allah Subhanahu wa Ta'ala, who has given us grace and mercy together in this international virtual conference in nursing. The honorable guests of the 5th International Virtual Conference in Nursing. STIKIP PPNI Jawa Barat is, as a nursing education institution, carries out the mandate to create professional nurse. We must implement all three Dharma University activities in academic atmosphere that aim to broaden and improve nursing and existence of nurse profession capacity in nation developing continually. As we know, the university academic quality is determined by its researches and graduate research quality. The research work result may be either right again managing intellectuality, wealth, equality, as well as scientific work which is able to be published through scientific journal and scientific gathering forum of the same scientist background both in national and international level. That's why internally nurse professional scientific nurses research journals are still less of publishing. It is alleged to the law of quantity and quality publishing about nursing. One of the drawbacks is rarely the interaction between nursing scientists and experts in scientific conference. Some efforts are carried out by STIKIP PPNI to encourage and accelerate sharing knowledge among the nursing experts. Alhamdulillah, thanks God, in last 3 years, the number of scientific articles published by STIKIP PPNI Jawa Barat in West Java, especially those indexed by Scopus, continues to increase significantly. This is a good effect of holding publication through IPCN every year. Ladies and gentlemen, as information for you that STIKIP PPNI Jawa Barat is carrying out the 5th International Conference, and Alhamdulillah, all the conference had done successfully with collaborative and cooperative with various national and international universities. So in this occasion, STIKIP PPNI Jawa Barat would like to say thank you to all co-hosts who have joined and carry out the conference. This IPCN is different with the previous IPCN because today we are the COVID-19 pandemic condition, so that we can carry out in normal but in virtual conference. Ladies and gentlemen, this COVID-19 pandemic condition may be good study or lesson for us as a nurse profession, but in education and service file, many things are able to subject or researches that the results of them can help reduce and solve the effect of pandemic in health communities. Honorable ladies and gentlemen, nowadays in the global era, the transformation run rapidly and consequently, it makes the knowledge-based society. Information and communication technology development have very important role in manifesting society development based on the knowledge. The higher education of society will be higher of health service quality demand, especially for nurses. According to the effort, this international conference aims to 1. Facilitate the knowledge sharing between health experts and nurses to encourage the goal of health human research quality. 2. Produce health scientific and nursing articles deserve to be published on international industry journal. 3. Make communication networking among universities, research institutions, nurse practitioners, and other stakeholders. I truly believe that all participants today in this international conference are able to manifest our goal above well. Honorable ladies and gentlemen, finally, I would like to thank to all of participants, diligently and with spirit of attending this international conference with theme post-pandemic healthcare transformation and innovation force in focus. I wish the conference is able to be knowledge sharing, open and delightful and successful as well. The conference will be enlightening and interchange where the great help for us after attending this conference, especially Stika PPNI Jawa Barat and generally for all professionals who provide health service to communities. Amin ya Allah ya Rabbal Alamin. On this valuable occasion, let us bow our head for a moment to pray for our professional colleagues, the nurses who die as the front line in tackling the COVID-19 pandemic. May God Almighty forgive their sin and place them in His heaven. Amen. Ladies and gentlemen, as my closing speech, let me express my best and great gratitude for all of you are the guests and participants who attend and join this IPCN event and have enjoyment this program. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Mr. Diwa Agus Sudrajat, for your speech.
For the next agenda is opening speech from Chairman DPP PPNI or Dr. Harip Padilla. Time and place is yours.
Assalamualaikum warahmatullahi wabarakatuh. Good morning. The Honorable Ministry of State-Owned Enterprise, Mr. Erick Thohir, who is willing to attend on this event, though he has many state duties, especially in handling of COVID-19 in Indonesia. We are very happy. The Honorable, our colleagues from Indonesian National Nurses Association, Jawa Barat board member, Mr. Wawan Hernawan as a chief, and the Honorable, the head of Stika PPNI Jawa Barat, and all of the staff, the Honorable, the board member of Perawat Nasional Indonesia Foundation Jawa Barat, and our special guest from other country, Professor Faridah Muhammad Said, Professor Nur Salam from Indonesia. So I inform you about Prof. Nur Salam is as my promoter in doctoral study, and he is my motivator too. Thank you very much. And the Honorable, our colleagues, Sing Mei Chan, PhD RN, Mrs. Maria Elizabeth, and Mrs. Sunny Cheng, RN PhD, Mrs. Theodore Stickley, and so also our colleague from Stika PPNI Jawa Barat, Winnie Handayani PhD, and the Honorable, all of the participants International Virtual Conference of Nurses Stika PPNI Jawa Barat. It was an honor to able to give the speech in this very, very special event. The 5 International Virtual Conference Nursing of Stika PPNI Jawa Barat, which was well organized even during the pandemic situation. And as you know, nurses right now as the front line in COVID-19 handling. And to this and until right now, this day, they are still working hard, even though they are also experiencing difficulties in the task. Previously, I would like to express my deepest sorrow for the death of hundreds of thousands of nurses worldwide due to COVID-19, including 667 Indonesian nurses who have also died. The COVID-19 pandemic has taught us many lessons in life, including our life as a profession in nursing especially. Nurses must be more disciplined, adhere to standards, have a high empathy with the other, and increase cooperation in the tasks. And very important, the pandemic also teach us about technological innovation utility. All of both is what we call the new norm of life, and we have to require a change in our attitudes and behavior. I appreciate this conference as a part of achieving adaptation to new life, which is very useful, especially for the campus life and also the working condition of nursing in the healthcare system. The last, I would like to say thank you and congratulations to Stikap PPNI Jawa Barat for the implementation of this conference. I hope this event goes well. Good morning. Assalamualaikum warahmatullahi wabarakatuh.
Thank you for Dr. Hari Padilla for your opening speech. Ladies and gentlemen, let me introduce our co-hosts in this event by watching company profile video from Stikas Panakukang Makassar and Stikas Sukabumi.
Assalamualaikum warahmatullahi wabarakatuh. May Allah subhanahu wa ta'ala give us our salvation and blessing. Thanks to Allah subhanahu wa ta'ala because we are still given her favor to be here. Don't forget salawat and greeting for our Prophet Muhammad sallallahu alaihi wasallam who taught their people goodness. My name is Iwan Permana, the headmaster Stikas Sukabumi. I would like to express my appreciation to the Stika PPNI and crew for Event Nursing International Conference. I hope that this event will help us to grow ourselves professionally and good cooperation. Then, I hope that this event will run smoothly and successfully. Thanks everyone. Assalamualaikum warahmatullahi wabarakatuh.
Institusi pendidikan di bidang kesehatan pertama di Sukabumi yang didirikan oleh Yayasan Pendidikan Tinggi Kusuma Bangsa. Stikes Sukabumi tercatat sebagai institusi pendidikan kesehatan yang berstatus akreditasi B dari BNPT. Terdapat 4 program studi yang menjadi unggulan dari Stikes Sukabumi, yaitu Diploma 3 Kebidanan yang unggul dalam Entrepreneur Kebidanan, Diploma 3 Keperawatan unggul dalam Kegawat Daruratan, serta Sarjana Keperawatan dan Profesi Nurse unggul dalam bidang Kegawat Daruratan Bencana. Yang masing-masing program studinya telah terakreditasi B oleh LAMPTKes. Proses pembelajaran di Stikes Sukabumi ditunjang oleh berbagai fasilitas, seperti gedung OSCE untuk menunjang dalam pelaksanaan ujian praktik laboratorium, CBT Center pertama yang berada di wilayah kota Kabupaten Sukabumi, Cianjur, dan sekitarnya dalam rangka untuk pelaksanaan uji kompetensi berbasis komputer. Laboratorium yang terdiri dari Laboratorium Kebidanan, Laboratorium Keperawatan, dan Laboratorium Biokimia, Perpustakaan, serta sistem informasi akademik yang terintegrasi sehingga setiap mahasiswa memiliki akun pribadi yang dapat digunakan dalam setiap kegiatan Sivitas Akademika di Stikes Sukabumi.
Terletak di antara dua benua dan dua samudra, menjadikan Indonesia sebagai negara maritim terbesar di dunia. Sulawesi Selatan yang beribu kota di Makassar adalah salah satu provinsi dari 34 provinsi yang ada di Negara Kesatuan Republik Indonesia. Stikes Panakukang Makassar merupakan institusi pendidikan swasta yang dinaungi langsung oleh Persatuan Perawat Nasional Indonesia dan Yayasan Perawat Sulawesi Selatan. Melalui surat keputusan Mendiknas tanggal 3 Oktober 2006, Stikes Panakukang Makassar menyelenggarakan perguruan tinggi di bidang kesehatan, khususnya program studi D3 dan S1 keperawatan, program studi profesi nurse, program studi D3 rekam medis, dan informasi kesehatan. Terkhusus bagi program studi D3 Keperawatan adalah program studi yang berdiri sejak tahun 1991 dengan nama Akademi Keperawatan Panakukang Makassar. Sedangkan program studi rekam medis dan informasi kesehatan berdiri sejak tahun 1998 dengan nama Akademi Perekam Medis dan Informasi Kesehatan Panakukang Makassar. Kedua program studi ini merupakan perguruan tinggi swasta dan pendidikan tinggi rekam medis dan informasi kesehatan pertama di Sulawesi Selatan. Seiring berjalannya waktu, dengan adanya tuntutan dalam dunia keprofesionalan, termasuk profesi keperawatan, bahwa pendidikan dasar dari suatu profesi adalah sekurang-kurangnya jenjang pendidikan strata 1 sebagai pendidikan akademik dilanjutkan dengan pendidikan profesi. Atas dasar inilah Persatuan Perawat Nasional Indonesia dan Yayasan Perawat Sulawesi Selatan menggagas penyelenggaraan pendidikan S1 program studi ilmu keperawatan. Visi menjadi institusi penyelenggara pendidikan yang menghasilkan tenaga kesehatan profesional berwawasan global dan unggul di Indonesia Timur tahun 2021. Misi 1. Menyelenggarakan pendidikan dan pengajaran yang efisien dan bermutu tinggi dengan menghasilkan luaran yang profesional guna mendukung pembangunan nasional. 2. Menyelenggarakan penelitian bermutu dan terkini dalam bidang kesehatan. 3. Menyelenggarakan pengabdian masyarakat dalam bidang kesehatan dengan terwujudnya daerah binaan. 4. Menyelenggarakan tata kelola yang baik, good governance. Kami berterima kasih kepada semua pihak yang turut andil dalam mendukung dan membantu berkembangnya Stikes Panakukang menjadi institusi pendidikan yang bermutu sehingga mampu melahirkan tenaga-tenaga kesehatan yang unggul serta profesional.
Distinguished guests, delegates, ladies and gentlemen, it's our honor to have the Minister of State-Owned Enterprises of Republic of Indonesia, His Excellencies Mr. Erick Thohir, as our keynote speaker. But before that, I would like to read the briefly CV of Mr. Erick Thohir. Mr. Erick, as 23rd October 2019, become the Minister of State-Owned Enterprises. He is having an educational qualification from Master of Business Administration, Glendale Community College for Bachelor of Arts and National University. He is also the President Director of Masyarakat Ekonomi Syariah for period 2021-2024. As we know, Ministry of State-owned Enterprises plays the important role in implementing vaccination in Indonesia through Indonesia Healthcare Corporation by setting up sentra vaksinasi bersama. Without further ado, please welcome Mr. Erick Thohir to deliver keynote speech, and afterward, we would like to request the Minister to open the event. Time and place is yours.
Good morning. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam
Harif.
warahmatullahi wabarakatuh.
Dr. Harif Fadilah, Chairman of DPP PPNI, Mr. Wawan Hernawan, Chairman DPP PPNI West Java, Mr. Diwa Agus Sudrajat, Chairman STIE KEP PPNI West Java, distinguished keynote speakers and participation of the 5th International Virtual Conference in Nursing. Healthcare is a human's basic needs, and hence its management is the key factor to achieve human well-being among other factors. The demands to have a better healthcare management has been further realized and escalate ever since COVID-19 pandemic hit the global population, especially we as a government, we also want to transformation the healthcare system in Indonesia. In Indonesia, the first case of COVID-19 was documented in March 2020, and the pandemic spreads fast across the country, with the worst positive case documented approximately 50,000 cases per day a few months ago. Recognizing the negative impact of the pandemic, the government of Indonesia took a quick mitigation steps by initiation forming KPCPN, the Committee of COVID-19 Response and the National Economic Recovery. The establishment of this KPCPN, of which reporting structures is directly under the President of Republik Indonesia, Bapak Insinyur Haji Joko Widodo, shows the seriousness of the government of Indonesia to focus on controlling the COVID-19 pandemic by containing the spread through implementation of 3T, testing, tracing, and treatment programs, and 3M, campaign wearing masks, washing hands, and maintaining physical distance. Recovering the public health through vaccination and acceleration economy recovery. I think those the task force that we have to do. Which KPCPN directly under the president of the committee has the power to make policies that are not bound by the bureaucracy among ministries and local government. And this has led the effectiveness of COVID-19 response. As observed, KPCPN has introduced a number of breakthroughs, and one of the key breakthrough is on the vaccine availability and accessibility, which now lead Indonesia to be one of the most vaccinated country by doses. The effort introduced by the government of Indonesia to secure vaccination availability and accessibility is extensive, and the present is still not exhausted. International cooperation placing Indonesia at the front of the countries to obtain the first 40 million doses of COVID-19 vaccine in bulk by December 2020. Moreover, Indonesia also took an early steps in the multilateral cooperation with the Global Alliance for Vaccine and Immunization, Gavi, COVAX facility, and the World Health Organization, WHO, to further secure the provision of vaccine. In the first phase of the period of January to April 2021, the vaccination was targeting all health workers at public health service facility, which reached 1.4 million people. Then process with the second phase vaccination delivered to the public, service officers, Indonesian Army, police, and the elderly with a total 38.9 million people. Through the third phase, the period of April 2021 to March 2022, the target shifted towards people who are in the high risk of COVID-19 infection. In this period, the target of vaccination was 63.8 million people. Then process with the fourth phase of vaccination. This vaccination for the general community and other economic stakeholders. The program is delivered by adopting the cluster approach and tailored to follow the availability of vaccine. In this group, the target is vaccinating 77.2 million people. In delivering the aforementioned program, the government of Indonesia has gradually received the arrival of 5 types of vaccine, which are Sinovac, AstraZeneca, Sinopharm, Moderna, and Pfizer. The total vaccination in country is now experiencing 225 million doses, both in raw materials and finished product. The process to produce ready-use vaccine is carried out by Bio Farma, the Indonesian state-owned enterprise or for vaccine manufacturing and following the distribution authorization from the PPPOM. The Indonesian Food and Drugs Authority, a total of 139.8 million vaccine have been distributed. Based on the Minister of Health data on 5th September 2021, 106 million Indonesia have received vaccination up to the present. This achievement placed Indonesia as the 6th country in the world for vaccination delivery. Despite this achievement, the government is still working hard to accelerate its vaccination program, focusing on the elderly populations and delivering the national vaccination target of 208.2 million people. In achieving this enormous target, the vaccination rate has been increased in line of the number of vaccination distributed, and the government seeks support from all stakeholders, the Army, police, state-owned enterprise, National Intelligence Agency, as well as from the private sectors. Additionally, the government of Indonesia is also working hard to secure the provision of vaccine for a long term. This is achieved not only through direct purchase from the global manufacturers, but also encouraging local researchers, either through local research centers or collaboration of local industry and international players. At the present, there are a number of local universities such as Erlangga University, University of Indonesia, and Ekman Institute working in developing our local vaccine, namely red and white vaccine or vaccine merah putih. In the state-owned enterprise, we're also working with the various local and international players in developing local vaccine. Our recent work with Baylor Institute of United States has shown a good prospect to produce our own local unit protein recombinant-based vaccine. In the Game of Thrones, there is a famous quote, "Fire cannot kill a dragon." This analogy is also applied to our current situation that vaccine will not kill coronavirus. Hence, in addition to vaccination, the government has also exercised the Community Restriction Program, PPKM. PPKM program is not a standalone by itself. Its success is also as a result of programs such as the provision of COVID-19 drugs packets and the implementation of tracing and trace apps named Peduli Lindungi. Jointly with the Coordinating Minister of Marine Affairs and Investment, Minister of Health, and the Indonesian Army, the provision of the drug packets is made available for COVID-19 light symptom case and has been distributed across Indonesia with a total 600,000 packets. Peduli Lindungi apps has been used a mandatory national application. Up to 5th September, there have been 52 million active users. So we're going to push this number around 70% of the populations. All programs have had a positive impact. It was recorded that the national cure rate reached 98.8% by beginning of the September 2021, and this figure is greater than a global cure rate of 89.8%. The number of national active case decreased by 65.3% compared to initial PPKM leveling in August 9, and the national board also decreased by 76%. Hopefully, the effort of Indonesia and also other countries in the world in fighting the COVID-19 pandemic through vaccination with health workers as the mainstay at the forefront will give maximum result to form a resilient Indonesia, a growing Indonesia, what we call Indonesia Tangguh, Indonesia Tumbuh. Finally, exposure to what I say in this very precious opportunity from the bottom of my heart, I would like to express my gratitude and highest appreciation to all nurse and medical through Indonesia and global for their hard work to fight this pandemic. Once again, thank you from the bottom of my heart. You have carried out this noble profession with full sincerity and dedication, without hesitation, even though your life and your family are at stake for the sake of healing patients and for the health of all mankind. Thank you for this opportunity to share my keynotes. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Mr. Erick Thohir, for the wonderful and the meaningful speech. But before Mr. Erick, are you still with me? Mr. Erick?
Yes.
May I take a picture first with the audience before leaving?
Most welcome.
Okay, thank you. For the audience, please open the the camera on so that we can take the picture with the Minister of State-Owned Enterprises and also the distinguished guests. Please on the camera. Okay. I will count to 3. Please, the committee, help me to take a picture. 1, 2, 3. Once again. Okay. 1, 2, 3. Okay, thank you very much, Mr. Erick Thohir. In your busy days, you can come and join in our international conference. It's a very honor for us. Thank you very much.
Yeah.
Assalamualaikum. Iya, ini Pak Masdum. Good morning, everyone. Welcome. And from Taiwan, I think I saw from Taiwan, from Philippines, I think Mr. Masdum. Welcome and joining the international conference this morning. You can on the camera and say hi to the camera. Thank you for joining us in the 5th International Conference in Nursing. Yes, of course. Hope you enjoy this conference. Okay.
I'm going to be more than
Master of Science in Nursing, National Cheng Kung University, Nurse Profession in Stikas Panakukang Makassar, Bachelor of Nursing in Stikas Panakukang Makassar. Interest area, Mr. Apriyatno is Community in Nursing, focus on SIKAL Activity in Development Program. Professional experience, he is Chairman Quality of Control Stikas Panakukang Makassar, Nursing Faculty Stikas Panakukang Makassar, Teaching Assistance in Evidence-Based Healthcare in Nursing, National Cheng Kung University. Assalamualaikum, Mr. Apriyatno.
Waalaikumsalam. Greeting from Makassar.
Yeah. The second moderator is Mrs. Agni Laili. Okay. Mrs. Agni Laili is Master of Science in Nursing, National Cheng Kung University, Nurse Profession in Universitas Pajajaran, Bachelor of Nursing, Universitas Pajajaran. Latest publication, Identifying Clinical Future Employed Status Among Children with Suspect Dengue in Indonesia, Malhayati International Journal of Nursing and Health Science. Nutrition status as predictor of dengue severity among children in Indonesia, Malaysia Journal of Medicine and Health Science, MHS. Professional experiences, now is teaching assistant infection prevention and control NCKU, translator International Medical Center, National Cheng Kung University, and lecturer in STIKAL PPNI Jawa Barat. Without further ado, welcome Mr. Apriyatno Jose Alfredman and Mrs. Agni Laili. Mr. Apriyatno and Mrs. Agni.
Yes. Yes. Okay. Thank you very much, MC. Thank you for your great introduction. Selamat pagi.
Apa kareba?
Good morning.
Ciao an.
Magadang. Good morning, ladies and gentlemen. Good morning to our honorable guests, of the speakers, co-hosts, and all participants. Welcome to our first panel sessions. I'm Apriyatno Jose Alfredman Koa, along with
Miss Agni Laili Perdani, who are serving as a moderator in this session.
Okay, hi, Miss Agni.
Yeah.
Greeting
Hi.
from Makassar.
Okay, hi Makassar. I'm lovely and
Morning.
healthy. Thank you for asking. How is Makassar so far?
Yeah, I think in Makassar it is sunny and warm. Thank you, Miss Agni. Yeah, well, before we welcome to all the panelists from the sessions, we would like to announcement that some rules.
The session will last around 1 hour and 22 minutes. Each panelist will deliver their topic for about 30 minutes, and at the end of the session, we will have a discussion time for about 7 minutes based on time concerned.
Okay, for all of the attendants who have related to the topic, please ask by writing down your questions in the chat room at the bottom of your screen. We will select some questions to be discussed in this discussion session.
We are glad to welcome Professor Dr. Faridah Mosaid and Associate Professor Sing Machen, PhD, RN, who will deliver their amazing speech. First, Professor Dr. Faridah Mosaid from Malaysia will deliver topic with the title is Accelerating Contactless Primary Healthcare Service, Post-Pandemic Healthcare Transformation and Innovation in Focus. So I will read about her CV. Professor Dr. Faridah Mosaid is postgraduate nursing studies from Faculty of Nursing, Lincoln University College, Malaysia. He has many years working experience in the area of clinical nursing practitioner, academic as well, and management through her career in both public and private organizations. And he also well experienced included in clinical nursing in Saudi Arabia, in Lincoln, and involved with international mobilization academically and upskill program. She has supervised many PhD students and publications. She was awarded Excellent Outstanding Quality Patient Safety Award in Madinah. She received 4 RMC research grants while in UPM and was awarded Erasmus Mundus Scholarship. Well, she is very amazing indeed. Okay, now without further ado, we will turn the time over to Professor Dr. Faridah Mosaid. Time and place is your professor.
Thank you so much. Thank you for a very nice and very elaborative introduction. Thank you so much. And today I'm not going to give any lectures. We're going to share and learn from one another. So this is more of a relaxing way of how we can learn. All right. So let me share my slides. Is my slide audible? Can you see my slide?
Yes, Professor. Your slide already slow in our
All right,
screen.
thank you. You can hear my sweet voice?
Your voice is clear.
All right, thank you so much. Okay, so today I'm going to discuss, or we're going to share a bit of something to do with the public health. Okay, this is about the accelerating contactless primary healthcare services, post-pandemic healthcare, the transformation and innovation in the focus. I'm Dr. Faridah. I'm in charge of postgraduate nursing studies in Lincoln University College, and I have so many students from Indonesia. So whoever are interested to do PhD in Lincoln, please do contact me. So I'm doing a bit of digital business now. All right. Okay. So thank you, Madam and Mr. Moderators. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and very good morning to all those honorable guests and the speakers, as well as our participants. It is good to be in this 5th International Nursing Conference, which is organized by the STI CAP PPNI. I'm also very excited, super excited. And I'm so glad to be in the conference, sharing and learning from everyone. All right. And I would also like to take this opportunity to express my big thank you for inviting me and allowing me to share. And I also would like to congratulate all those committee members or the committee team who work so hard day and night, directly or indirectly, to ensure the conference is becoming reality as well as successful. Congratulations. I also would like to take this opportunity to congratulate all those nursing leaders who are behind this conference as the backbone and the motivators. So as for this conference, just as Mr. Dewa Agus and Dr. Haris Fadli for be the moderator and become the nursing leaders for this conference. As what I'm sure Dr. Arif mentioned just now, the COVID is the turbulence in our life and how it already changed our lifestyles. So now we are more of the becoming more familiar with this digital application, because for those young generation who are born during the digital era, they do not have any problem. But those who are the baby boomer like me, so we have a lot of problem in adapting with the digital era. So this conference is really appropriate for all levels to engage themselves in the digital era. All right. So this is my outline. So we're going to discuss a bit on emerging of MERS-CoV. We are looking also at the global, how the global is coping with this pandemic. And we're also going to look at this transformation of digital health technology. transformation of digital health in public health, patient-centered care transformation innovation, and innovation of VPCR. So I'm sharing a bit of our project by my PhD student, that is the VPCR application. All right. So if you look at the history of pandemic, so if you look at this picture, so it relates on how our great-great-grandfathers also experiencing the same situation, the same turbulence that we are facing now. For example, so they are also facing some of these issues with the overcrowded quarantine centers, expansion and extended of this hospital. So they have to do all as what we are doing now. We are also looking at some of those young children who has to wear on masks, and we also look at the transformation of the designer face mask. So it is not something new that we are experiencing now. So this is a sort of the recycle of the pandemic. In other words, I would say that it's a recycle of the pandemic in a different era. So interestingly, when in the public health sectors, when the epidemiologists looking at the cause or the agent of causing this pandemic, okay, you can see the emerging and re-emerging of this pandemic is caused by the virus H1N1, and it's also been evolving. So until it also reached to the level of H3 and N2. So it is all about the emerging and re-emerging of the pandemic. So we are going to expect this emerging and re-emerging of the disease every now and then. So what are the impacts of this pandemic to us? It's not only in Malaysia, not only in Indonesia, all over the countries. In other words, globally is being affected by this pandemic. So for those, I have all my students from Indonesia was asking, when can I come to Indonesia, to Malaysia, to have this roti canai? Because when we come to Malaysia, they will ask for roti canai. So this is more of because of the travel restriction. Travel restriction is not only internationally, but it's also locally, because in Malaysia, even in Indonesia, everywhere they have the travel restriction within a different districts. So there is a travel restriction. So when there is a travel restriction, the impact on the mental health, the socialization also be affected. All right. So it also have changed the geographical landscape of the world. If you look at now here, how much and how sad, if you can see, there is some changes in the geographical landscape of our all over the world. You can see a lot of people being buried compared to the normal, extraordinary compared to normal. Similarly, you can see how these people was affected in terms of COVID-19. They are being admitted in the hospital. They are separated from their families. But not only we are talking about the patient itself. Of course, they are the one who's much affected. But those people who are working, looking after this patient also been affected by this COVID-19. So the impact of pandemic is very, very great. Okay. So how does the global coping with this pandemic? All right. So there are different ways of people, which countries coping with this pandemic. But I think everybody observed that widely and intensively, the use of digital technologies have been an important feature of global response to the COVID-19 pandemic. All right. No country that effectively deal with the pandemic has relied upon only one measure alone. All right. Clearly, applying the technology has become an important tool containing the pandemic. Studies have shown that countries that has long established with the digital R&D perform better. All right. So why they say that countries who have established the digital R&D perform better? According to global data, they say they are taking Singapore as example. Similarly, South Korea. So these are those countries who have all those investment on this digital health. Okay. So 7 pillars of investment made by the Singapore government to strengthen its technology capabilities in healthcare sectors for years now is playing a major role in controlling the virus. So what are these 7 pillars that they are referring to? So they have digital medical education, they have a digital telemedicine, they have electronic medical records, they have patient solution, which they call it Avis Health, they have medical diagnostic, they have health management solution, they have personal health fitness. So in other words, they have all these pillars that can support them in terms of how to control this pandemic. But it doesn't mean that countries like Malaysia and Indonesia do not have that. We do have that, but the extension of and the capability, we are talking about the capabilities that we have is not as extensive as in Singapore as well as in Korea. Right? Similarly, WHO said that digital health provides an opportunity to accelerate, okay, this is the word that I want to use, to accelerate the progress in attaining health and well-being related to sustainability development goal, SDGs, especially SDG 3, which is all related with the well-being, health and well-being of the community, okay, especially SDG 3 and achieving the 3 billion target for 2023, all right? So if you look at the pathway of digital transformation, so actually this digital transformation already started long in 1990s. All right. However, because of the population is not really ready, so the adaptation and the acceleration of this digital health transformation was a bit slow. Why there is some limitation, or what is the setback for the acceptance of this transformation? Because of, as shown here, there are 6 attitudes towards this technology among the society itself. So they have 6 there: the one who hate technology, the one that feels that the technology hates them, and they have the person who are eager to learn, and those people who are already in that area. So if you look at all these 6 groups of people, you can see that, as I mentioned earlier on, we have a different generation that makes the some challenges in terms of adopting this digital health. Okay. So what are the reasons for especially those who are unable or try to be negative on this? It's because of that they have lack of understanding, lack of vision, fear of rejection, and of course the lack of profit. So these are some of the reasons why those days when they want to introduce the health transformation, they receive some rejection or what do you call that? Now the younger generation will say what do you call that? Response. So ACC, the American Cardiac American Cardiac sorry, I forgot that. Okay. So the unintended consequences of technology transformation. Why this is related to my previous slide. So why there is some rejection? The technology advance occurs too fast for the existing healthcare practice to keep up. So that's the reason why they have they receive a lukewarm acceptance, okay? Thus creating a mismatch between the rate of development of a new technology and preparedness of the system for effective integration and utilization of the new technology-based initiative. So that was the reason when the technology was too fast and people is not ready, so you're bound to receive some rejection, all right? But now, if you look at the current situation, there is a changes in the landscape of this digital health. When digital health is become the part of life in everybody, during the millennium era. Who are those in the millennium era? Those people who are born during the digital era. So slowly, those who are baby boomer trying to catch up with this millennium era. So they have to accept that they have to follow or they have to move on with the millennium era, because they found that there's this rebooting medicine and health is very important towards their life. So now everybody is slowly adapting and accepting this digital health. So because of this, because of the importance of this innovation, such as in the curative and rehabilitative transformation innovation, we can see a lot of changes have been done for the healthcare systems. For example, from the laser and digital surgery, from advanced treatment, for the lab investigation. So they have some artificial intelligence as part of your body. And you also have this robotic healthcare assistant as well. So that is the more reason why people is accepting and open to the digital healthcare, all right? On top of that, okay, on top of those changes, the service of the services, the hospital services is beyond than a treatment. Why I say that? Because previously people will say that hospital is just a place for you to get a treatment, but currently hospital become a business and a place for treatment. It's not like before. Because why hospital become a place for you to get to seek treatment? Because when you have a digital transformation, you can improve on the quality of patient care. You can deliver a better clinical outcome. Of course, you can improve the communication and care coordination. With all those, that definitely you are able to reduce the readmission and the fatality of a patient by 42%. That is quite a lot, all right? All right. So we already mentioned why is it important to have this innovation and how important are we going to accept all this digital innovation. So now we are going to move from overall digital transformation and innovation. We're going to focus on the public health, preventive transformation and innovation. All right. So when we talk about the public health, we are looking at the primary prevention. As you know, we have 3 levels of prevention. We have primary prevention, we have secondary prevention, and we have also tertiary prevention. But for public health, we are more focusing on the primary prevention. What is primary prevention? Normally, we do health promotion. We provide them advice and counseling services and education program. For what? To drive lifestyle changes for the prevention of chronic disease. All right. So in other words, public health is more of patient-centered care and we need to have a digital area. All right. Primary transformation and innovation in terms of primary prevention. Okay. It is very important to synchronize. See, I'm talking about the synchronization of the communication and data collection between the interdisciplinary healthcare team and the patient-centered care in primary prevention across digital health performance. So with this digital platform, so they have more of this communication, connectedness between the team. All right. Okay. We are talking about, okay, let me define. So when you say patient-centered care, we are empower people to have their empowerment on how to look after themselves. All right. That is what we're supposed to do in public health. All right. So transformation, innovation during pre and post pandemic. So if you look at this pandemic itself, so it's when we want to have this breaking the chain of infection. It's not, we are not only focusing during the pandemic itself, because breaking the chain of infection should be done all throughout our life. This is to prevent any break of the communicable disease. All right. Okay. What are the innovations? So very interesting when I look at these some videos on primary prevention in terms of removing the risk. So when we know that PPE is a very important way of how to prevent the spread of infection, but unfortunately, if you can see, majority people are not putting on the mask appropriately or correctly. All right. So this gentleman, Joyce Hester, has developed sensor to ensure that there is a compliance to PPE for the mask, because they want to make sure that the removal of this will be achieved. All right. So how it works, they're going to put this sensor at the mask so that when a person did not put on the mask correctly, you're going to give some alarms. So that is a very good. That will prevent from the all those the spread of this disease. All right. Another intervention in public health is that they develop a sensor for the respiratory system. This is very good in terms of how to identify or to detect people with COVID-19 symptoms, so that especially in the working area, so that those people who are with the symptoms can be separated, can be quarantined, or can be given a leave so that they should not contaminate the other staff. So this is some of those interventions. All right. So another area which is very important in the public health is that contactless contact tracing. If you work in the public health, I'm sure you can imagine, you understand how is it difficult for us to do some contact tracing because of the different geographical, a lot of missing information and a lot of missing cases. So we have a lot of defaulters. With the current innovation where they use that tracking system, they can identify those people with the risk. All right. Okay. All right. So now you can see during this COVID-19, what happened is that you can see that the COVID-19 pandemic has accelerated the needs for a robust digital health contactless ecosystem in order to deliver telemedicine for continuous patient-centered care, especially high-risk cases, and to deliver remote care and to supervise task shifting. So what I mean by task shifting is that when the family members has to look after the sick person or the sick family members at home, because now with the COVID-19, with the limitation and with all those people are not willing to go to the hospital, so the task shifting is happen in the home. All right. So this is some of those areas. But now I would like to bring you to another area in the public health as well. In public health, especially in nursing, we are looking after the pregnant women. So we know that in during COVID-19, pregnant women has most highest risk compared to the non-pregnant women. And I'm sure we have a lot of data on how many pregnant women who died because of the COVID. And they have a lot of other complications like preterms and fetal distress and so on and so forth. So we can get a lot of this information from the site. All right. So during COVID-19 pandemic, many pregnancy-related services could be delivered via telemedicine. So if you look at this, the model, you are looking at the model here. So if you look at the green one, it's all about the prenatal. So when you can do the home monitoring, consultation, and virtual prenatal care through the virtual, why not? That would be most appropriate. And service delivered after postpartum is like lactation support, virtual postpartum delivery, and so on. Okay, so this is all those the services that are required can be done through the virtual. All right. So the model for pregnancy management. So based on that, come up with this idea of BPCR, birth preparedness and complication readiness, with the aim of to ensure that there is a safe delivery and better pregnancy outcome. All right. So we have this early detection of danger sign is that if in Malaysia, we have this what we call the high risk pregnancy code. I think similarly in Indonesia, in some countries also, they have this what do you call that coding for the obstetric care. So when you have the green, yellow, and red, so the red means that they are the most high risk cases. All right. So the reason why I share you with this BPCR is that it is very important so that we can implement this throughout Indonesia, because we found that I understand that in certain countries where maternal mortality is still very high. So this by implementing and adopting this what we call that mobile application will help to reduce the maternal mortality. All right. So this is basically what it is on the BPCR application. So the reason for that is that we want to have a reach out program and user-friendly, targeting on the primary gravida and teenagers pregnancy, because we know that primary gravida, they have less what we call that the knowledge, and teenage pregnancy, especially those who have underage marriage. This is a very important area for them to apply this application. All right. So this is some of the BPCR application. So what the mothers have to do is that they have to fill up all those information so that they can identify whether they are in the low risk or they are in the high risk. All right. So in the complication readiness, so what are the complication readiness that they have to know? They have to know about all those any complication like low blood pressure, the anemia, and different people who are going to help them with the if they have some complication. So at the end, after they have gone through all those things, and this is the end result. So based on that, they will identify, they will know what level they are, whether they are having the high risk, and what if they are on the high risk, so what are they supposed to do? Are they going to be in the hospital? Are they going to be at home, and so on? So this is a very important area where we can adopt in order to prevent or to reduce maternal mortality. So BPCR application is good for MGD5 and SGD3. And we say that complication readiness and broad-based application is a model of early detection of high-risk pregnancy and prevent complication in preventing maternal mortality. BPCR and drug application help pregnant mothers to determine birth attendance, place of delivery, risk factor of pregnancy, obtain related health education in addition to relevant information in dire of emergency, example like the blood donors and transplantation. BPCR digital e-health model is in line with the Society 4.0. All right. So what is the another area that another area that I would like to share is that what is my current interest area and what are my students are doing. So
Sorry, your time is 10 minutes left.
All right, I'm finishing now. Okay, so we are looking at project like smart cardiac rehabilitation. Why? Because now we have many of those young adults who is productive having some cardiac problem. We have hemodialysis from the younger generation, and we have a lot of stroke patients who are from the younger group. So that is the reason why we need to accelerate this digital application so that we can help all those young generation. So in summary, digital pathway is a post-COVID recovery in healthcare system. It also the post-recovery for education at all levels, okay, even from the primary school up to the university level. Now is the time to accelerate the digital pathway for the post-COVID recovery. In conclusion, I take from Peter Drucker, this is very important. The greatest danger in time of turbulence is not the turbulence, but it's the act with the yesterday logic. So we always think yesterday and yesterday. That means that we're not going to move on. So we have to think differently. So our key learning is that COVID brings us and reshape our health. Digital transformation is a must for the new reality, and people has a different point of view in health and medicine. With that, thank you. So thank you so much for your attention, and I hope with that the sharing will enhance our public health. Thank you.
Thank you very much, Professor Dr. Faridah Mosaid from Lincoln University College for giving such informative and great speech.
Right.
Okay, stop sharing.
All right, thank you, Professor. Okay.
Welcome.
Hello, my voice is clear. Sorry.
Yes, I can hear you.
Okay, thank you, Professor. Now we are moving to the second panelist, is Professor Hasim Meichen, PhD RN from Department of Nursing, College of Medicine, National Cheng Kung University, Taiwan. So she will deliver the topic related to the OSCE implementation and modification during the COVID-19 pandemic. So before we welcome Professor Hasim Meichen, PhD RN, I would like to read her curriculum vitae. Okay, Professor Hasim Meichen is Associate Professor in Department of Nursing, College of Medicine, National Cheng Kung University, Taiwan. And for her education qualifications, she was graduate from the University of Texas at Austin School of Nursing, USA for her PhD, and from National Taiwan University School of Nursing, Taiwan for her MSN, and also from the Kaohsiung Medical University School of Nursing, Taiwan for her BSN. And also for the professional experiences, currently she is the Associate Professor in the Department of Nursing, College of Medicine, National Cheng Kung University, Taiwan, and also Adjunct supervisor, Department of Nursing, National Cheng Kung University Hospital. And for the latest publications, like you see in the screens, they have a lot of the publications. If you are interested, just visit by typing her name. And so I would like to invite Professor Hasing Mei Chen, PhD RN. Hello, Professor.
Hi. Oh, Professor Chào An.
Hello, Professor. Chào An, Professor.
Yeah. Okay, I'm going to share my PPT.
Okay. Yeah. As we know, that Taiwan is one of the best countries to overcome this pandemic of COVID-19, and also the adaptation in the teaching method. So today we are so lucky. We learn a lot from our second panelist, especially related to the OSCE implementation and modification during the COVID-19 pandemic. Now we'll turn to the time over to Professor Hasing Mei Chen. Time and place is yours, Professor.
Okay, thank you, Yano and Agni. They are our outstanding alumni.
Thank you,
because,
Professor.
Yeah. Okay, because the time is very limited and the committee gave me 5 points to do the presentation. So I just go directly to my topic. Okay, we all know that probably, yeah, well-designed and implemented OSCE can provide students the opportunities to demonstrate like their interpersonal and interview skills, problem-solving skills, and teaching assessment skills. Then also the application of basic clinical knowledge. Yeah, so that is why many schools over the worldwide use OSCE to assess the students' ability. Okay, actually the concept of OSCE was based on the one very famous Chinese Confucian philosopher, Xun Zi. He said that what I hear, I forget, what I see, I remember, and what I do, I understand. So he emphasized learning by doing. So what is OSCE? Objective structured clinical examination. You can see here the picture is our international students. They were doing the OSCE. Yeah, it was first described by Harding and Grayson. That is from UK. The professors they are still very active in promoting OSCE and the simulation. Okay, and OSCE is a kind of examination. It is designed to test clinical skill, performance, and competence. Please just remember that is skill, performance, and competence in a range of skills. So it emphasizes practical, real-world approach to learning and assessment. So speak frankly, is a kind of assessment. Okay, so the O stands for objective. That means all the candidates, they are presented with the same test by the same rater. Rater means teacher. Okay. Then they say we have to, as a teacher, we have to set up the career goals. Then use specific criteria for the evaluation. Yeah, usually we the criteria is the core competence. Then here example is like here is a structural checklist. Then for each item, the rater evaluates the student's performance by 3 options: complete, partial, and none. So they give the score is 2, 1, 0. So this kind of evaluation we call rubric. So this kind of rubric will make marking more standardized and objective because the assessment is by the writer or the teacher. Okay. And S stands for structured. That is mean the checklist or the marking scheme for each station is structured. And we usually assess the students like a specific skill modalities, in each station, including such as assessment. For me, I implement OSCE for my health assessment courses already for more than 10 years. So in the assessment, including history taking, physical health assessment, and also can evaluate the students how they do the diagnosis to find out the patient's health problems. We also can do nursing management, patient education, communication, and fundamental and advanced skills. C and E stands for clinical examination. Why we say clinical? It means all the tests need to come from the clinical. And usually we use case scenarios. And for the case, it can be simulated patient or use high fidelity device to mimic a real environment. We also can use some devices like a SynScope to mimic the heart sound, breathing sound, or barrel sound. Okay. Then it tests the performance of clinical skills. So the students had to demonstrate their skills. For OSCE, it's not a test or knowledge. Then the approaches to OSCE, including such methods like multi-station OSCE. Usually in OSCE, we use multiple stations. I will have an example to you later. And it usually is scenario-based OSCE. Sometimes we call OSCA. We change the examination to assessment. So it's assessment, not a kind of examination. Then OSCE simulated assessment with random allocation, because sometimes too many skills we need to test. So we may separate the students into different skill testing by random assign them into several stations. It means not all of them go to all of the stations. And last example is OSCE. That is using videos to do the examination. I will show you my example. So the second part is the principles of OSCE implementation. For this part, I would like to use 3P to help you understand how to implement the OSCE, including policy, people, and the place. The policy is mean your university or government have to support this kind of implementation. Yeah, for example, in Taiwan, the first specialty to implement OSCE is our nurse practitioner, the NP licensure examination. Sorry, we started the NP licensure examination from 2006. Yeah, the government decided to integrate OSCE as the part of assessment in the second stage of the examination. So the Ministry of Health and Welfare, they made an official announcement in 2005. So the nurse practitioner who were interested in taking the licensure examination, they can start to prepare. Then examinee has to pass the paper and the pencil test in the first stage, then they can move to the second stage of the OSCE. Yeah, which many doctors right now they use this kind of format to do the examination. Then, but here we only have one station, and all state it's 20 minutes. So the nurse practitioner had to finish the history taking and also the physical assessment. The second P is people who were involved in the OSCE, including examiners, which is raters or we call teachers. The second is we need a standardized patient or simulated patients. And also the third is the students, examinees, candidates, or we call trainees. And we need staffs, yeah, to help to run the OSCE. And the technicians, like they had to control the computer, the video recording, something like that. And also assistants, okay? So OSCE is very expensive because we need so many people to do it, yeah. And we also need the rooms, the settings, the machines. Okay, so for the examiners, the raters, actually we if the teacher want to run the OSCE, we need to receive the well training program. So for me, I also have several classes for the OSCE training. And if the examine for some national licensure examination, the raters need to get the official certification. Yeah, so there are many courses they had to finish and even do show their abilities. They can do the OSCE. And to observe the performance of the examinees, yeah, a particular task, then do the scoring based on the checklist. Here, I point out to score according to the checklist is mean you cannot change it. You can only follow the checklist to evaluate the student's performance. Okay, and had to contribute to the good conduct of the examination. Yeah, you had to start from early beginning to the end. Here, the next one is about the standardized patient. We call SP. The SP is an individual without health problem, or they have the health problem, but that is chronic but stable condition. Then the SP need proper training for history and the physical examination. And they are volunteer or paid employee. And for mostly they had to be officially certified as the SP. So because in Taiwan, our doctoral, the second stage or doctoral licensure examination also use OSCE. So many hospitals, the medical centers own a SP bank. So they had to hold the SP training every year, then give the certificate to the SP. Yeah. So if I am a teacher, I can ask the SP bank to support the SP to my class. But because there are some problems, in my example, I run the OSCE for the international program. So the SP need to speak in English, but because most SP in the hospital speak Chinese, so they cannot support. So I hire the senior international students to serve as the SP. So you can see here, some of them probably you know them. Yeah, they come to help. Okay, here is the place. That is the examination hall. You can see here, the students stand in front of the rooms. That is waiting for the test. And you can see the right-hand side is yellow. That is so actually Agni and Yano have been in the OSCE. That is the examination. And also in the class, so they already know about OSCE. Okay, so the place is almost located in OSCE Center or Clinical Sphere Center or an institute or medical college or teaching hospital. And it need to have a one-way mirror rooms. So you can see here is the one-way mirror. Then they have to have a control center, examination rooms, and also need a rest room for examiners, and the SP, and the resting area for the examinee. Yeah, so you need at least 2 rest rooms for those people, and also need a here waiting room and the resting room for the students. So at least 3 rooms. Then, because in Taiwan currently, the medical students, they need to receive the OSCE as the second stage. So our OSCE center need to be accredited accreditation by the medical association. Maybe every 6 years they have to renew. So they have to provide the appropriate setting, including the equipment for the OSCE. So it's very costly. Yeah. So, and you can see here is the rooms in NCKU, National Cheng Kung University. Because our students are not so many, so our OSCE center is small OSCE center, and you can see here we have 12 rooms, and for some medical university, they have more students. Their OSCE room is larger. So here is Agni. Yeah. Okay. The third part is about the principles for conducting an OSCE. Okay, and for this session, I also will start to mention the modification during the COVID-19 pandemic. In an OSCE usually including a circuit of shorter stations. Each station maybe 5 to 10 minutes. 10 minutes. It depends on the purpose. So, like I just mentioned, in our NP licensure examination, it's 20 minutes for one station. Okay, and the students is examined on a one-to-one basis. It's one-to-one only, with 1 or 2 impartial examiners. But for our nurse practitioner licensure examination, each room has 3 examiners. I mean 3 raters. Okay, so how many raters in one station? It also depends on the need. And patients who are either real or use simulated like ATERS or electronic patient simulators, it depends on your need. Yeah, and but mostly we use real real person to play as the patient. Here is the example from the literature. Yeah, that is from Brosnan, 2006. They run the OSCE for year 1 and the year 2 students. And the year 1, each station is 5 minutes. And for year 1, their station 1 is how to check the blood pressure. Year 2, station 2 is do the CPR. And year 3 is, station 3 is the stroke question station. However, I would like to emphasize again, because the OSCE is very expensive. Yeah, try to prevent to use OSCE to test the knowledge. And for year 2, you can see they have different skills, moving and handling station, CPR station, and also still shorter question stations. Yeah, that is the example. And one thing is, because each time have 3 students to do the examination. Student 1 in the station 1, student 2 in the station 2, and student 3 in the station 3. So every student, every station need to be independently to run the OSCE. So you can, the teacher cannot design like students in station 1 will bring the information to the station 2 to continue the test. No, yeah, it should be students finish the blood pressure, just the blood pressure for station 1. And here need another scenario for station 2. We cannot ask use the blood pressure you check for station 1, then you do the CPR. No, that is not correct. I mean, each station need to an independent scenario. Yeah, they cannot interfere each other. And here is the example from NCKU. You can see in our final term examination, we have, I set up 5 stations for the students. Then students 1 to station 1, and until students 5 start from the station 5. Okay, then after finish 10 minutes for each station. So after finish 1 station, they have to move to the next station. So students 5 need to move from station 5 to station 1. So it's a circuit, and each station have different topic. Okay, so when students finish the 5 stations, it's 15 minutes later already. Okay, and errors or OSCE implementation. For running an OSCE, it's not good if we do not give students any feedback and the teaching. Yeah, and rewrite the station. Even we do think the scenario have some problem, you cannot change the scenario during the OSCE. You still have to finish it until finish. Then you can have discussion with the colleague to modify the scenario in the future, for the future. And don't interfere with the simulated patient law, and unless the patient have some problem. Otherwise, just keep the patient themselves to create the law and design their own scheme. Just score the students according to the checklist. And taking history and the intervention is not in one station. That is mean when students decide what kind of intervention is good for the patient, they need to take a history first. Yeah, unless you already give very comprehensive information, otherwise you cannot separate the history taking in another station and do the intervention in another station. Yeah, they have to be together. The next is planning and delivering OSCE, including 6 parts. Yeah, I will explain each by each. The first one is the design scenario. As I mentioned, the scenario had to come from the real world, so from the clinical. So like here, I have an example is about the cardiovascular. Yeah, Daniel, 79-year-old, blah, 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 something that is a real patient from our clinical practice. But I may modify a little bit to more fit to the OSCE. Okay, and here this sheet is about student guideline. That is, we post on the door in front of the rooms. Yeah, from this student guideline, when students taking the OSCE, they need to read the guideline, including the background information, the scenario, and the test topic or goals. Here, your task, complete the physical assessment of the shortness of breath and explain the patient your findings. So here is the goals, and the test time is 10 minutes. So here is the basic information for the student guideline. And so how about if we cannot run the OSCE in physical, in person? We need to run the virtual. We can run the virtual OSCE. So you can write down the scenario, have a scenario, yeah, and ask the students to what are their tasks. Yes, so it's quite similar to the OSCE in person. Okay, so here it's the example from the literature. If you are interested in reading, in knowing more about how they run the OSCE in a virtual OSCE, you can assess this paper and read. Okay, and also not only student guidelines, we also have to think. When I run the OSCE, do I have enough letters and the SP? Yeah, so we need to write down everything, then to prepare the setting and the think. Can I have 5 stations, or should I delete 1 station, 2 stations? Okay, so here is the information about the SP, what condition, what kind of situation we need. Okay, and here is the preparation for the equipment. And here, okay, and also prepare for the checklist. Yeah, and here the C is SP instruction and the training guide. So we need to write a script. Yeah, because especially for the history taking, because during the history taking, the students need to ask questions to the patient. So we need to tell SP how to interact with the students. So you need to try to write down everything. Yeah. So here, like the objective of the exam is history taking. Your work is doing something. Then you need to prepare what. Okay. And so the script should be detailed enough to guarantee SP and ask them to presenting the same law for all of the students. So the SP is better. The SP is a stranger to the students. So the students will to keep the fairness. Yeah. So the SP can maintain their roles, same role for all the students. And then we had to do the SP training. So the examiner need to read and discuss with SP about how to present the scenario. Then also need to remind the SP to obey the principles during the assessment. Yeah, so later on we need to evaluate SP's performance. If the teacher found the SP leak any information to certain students, they will not hire the SP anymore. Okay, and you can see here the SP, they are preparing for, they are made up to meet the case scenario, because the case is 79 years old, so they had to like wear something and made up to show it's older, it's 79 years old. But during the COVID-19 pandemic, so everything had to do can be done from virtual. So you can see here the SP training is also online. Okay, and rater recruitment and the do the consensus. Yeah, so we need to decide how many raters we can have. Then we can decide how many stations we can have. Then once we have the raters, yeah, we need to reach the consensus. For some paper, they may use the term calibration. Okay, so how to reach the consensus is we need a meeting. Yeah, and then we also need to write down the rater guideline here and tell the rater your task, and also tell them how to do the scoring. For example, watch hands. Yeah, what does it mean complete? Yeah, it's to demonstrate the right procedures, partial or none. So we had to write down every item in the checklist and every item's rubric. Yeah, so the rater, they know how to do the scoring. And during the pandemic, if the same, we can do the virtual training. Okay, and for this one is the checklist I just mentioned. For 10 minutes OSCE, it's good if you say your items in the checklist, it's 10 to 15 items. Okay, so the students can finish the assessment during within 10 minutes, and the rating scale is 210. However, for the OSCE, almost the teacher will say an item is global rating about the ethical consideration. So if the students, even they get good scores from the checklist, but they violate the ethical consideration, they may fail from the OSCE. Yeah, so that is the global rating can provide professors to think maybe the students may have some problem, they can fail the students. Okay, then we need to evaluate the SP's performance, but the evaluation need to evaluate by raters and by students. Yeah, so if the SP have poor performance, then next time we will not hire this SP. And we also will report to the SP bank. Then we will also evaluate the students' satisfaction with the OSCE, yeah, to know that any part we can improve, yeah. So you including the quantitative part and also qualitative data to ask to them to write down their reflection. And after we prepare all of the material, we can do a rehearsal or run a pilot study to ensure the process. Okay, so here, the first one we need to do is briefing. So explain the students all of the procedures and give them like here the schedule and tell them the flow directions. Then they have better idea, yeah, to run the OSCE. And during the pandemic, also using the virtual, yeah, to introduce everything. Then after the OSCE, we had to do is we call debriefing. It's a kind of report or mission or task. One thing important is a learner's reflection on their actions is the key. It's very important to their learning process, learning experience, being guided, not driving by the facilitator. So debriefing is very important, and it can be done by writers like here. It's Dr. Lu Fenghua in our NCKU hospital. Yeah, after OSCE, he thought the students may still have some problem to run the to do the skills, so he demonstrated again the skill. And also we can invite the SP to give opinions, their opinions, to tell them how they feel the students' performance. Yeah. And during the pandemic, also virtual debriefing. Okay, so here I would like to, I think this session is more fit to the main topic, main goal of this OSCE session is what kind of modification we can do during the COVID-19 pandemic. The first three are from the literature, and the last one is my students and me. We run the OSCE, yeah, and it's her thesis, yeah. So the study we publish in a journal. Okay, the first one is the article is implementing an online OSCE during the COVID-19 pandemic. Yeah, that is from Harvard School of Dental Medicine. If you try to find such OSCE, online OSCE or during the COVID-19 pandemic, you can find many articles from the dental medicine. Yeah, okay, and it's a pre-doctoral program. Yeah, they use Loon link with 21 pre-assigned breakout rooms. Yeah, you have a big classroom and 21 breakout rooms. Then they invite 2 examiners from each of 10 disciplines and plus 1 rest station. Yeah, then they give the clinical case to each station 1 hour before the start time. Then each station have 6 minutes. Yeah, so they have 20 stations. Yeah, so it's 20 times 6. Okay, so it's 2 hours. Then when the allotted time has passed, the students need to move to the next room. So it's quite similar, yeah, with the in-person OSCE. but they more focus on the oral examination. Yeah, not skill, not procedure. For the example 2, it's changes in the OSCE of University School of Medicine during COVID-19. Yeah, that is from the medical school deans. That is in Spain. Okay, and they established a 20 stations OSCE type test for 6-year medical students. And so they say due to the pandemic, a computer-based case simulation OSCE, they call CCS OSCE, was established. So they could be simultaneous administered in the medical school video campus platform. Yeah, so they share the OSCE to the whole country medical schools. However, when they finished, they found out technical or procedural skills and the communication skills are very difficult to use virtual OSCE, the online OSCE. Okay, then the third one is maintaining the integrity of the OSCE. Yeah, because since it's virtual, the teacher cannot see the students directly. So maybe some students will cheat. Yeah, so they say, although the virtual OSCE may be controlled, maybe monitored, yeah, the feedback should be withheld until all students have completed the examination. Because once you tell students where you didn't do good, then the students may be offline and tell other students who didn't receive the test yet. Okay, so they say collecting a variety of case scenarios to reduce the discussions between students, among students, and limit the examination time may help to maintain integrity of the OSCE. Yeah, okay. And in this study, there are 3 university colleges of pharmacy. Yeah, they try to analyze and to share their experience. And in these 3 colleges of pharmacy, OSCEs are high stake. It means they have to pass the OSCE, then they can move to the next level of program. So high stake is mean the OSCE had to decide something. Yeah. So if they pass, then they can move to the next level. If they cannot pass, they failed. They had to stay in the same level. Okay. And faculty serve as both patients and evaluators. Yeah, so some of them act like a patient, and some of them are evaluators. Okay, and here is the example to show you how they do. Okay, so here they also present like the first university pre-pandemic and the post-pandemic, what they do. Yeah, the same, but still the same problem with previously. Yeah, only the virtual, the online part only test cannot test the procedures. And here is my example. Yeah, we developed the online OSCE, we call OSCE. Yeah, it's online medication simulation video. Yeah, so we find the nurses to find rights and the management, or how to manage the interaction during medication administration. So their task is we ask the nurses to recognize the medical errors. Then the next is to tell us what is the correct solutions to the errors. So here I would like to share with you, to show you one video. I'm sorry, the internet maybe have some problem. Can you hear?
Professor, your voice is clear. Maybe this YouTube is cannot playing because of the internet problems.
Yeah. Okay. So you can see the video, right?
Yeah, I can see the screens that you share.
I don't know what happened, but it doesn't have a sound. Yeah, it's just the silent. Yeah. You
Not
can
playing yet, Professor.
hear the background sound only. She is checking the name and the number of the ID number and the medications and the times. Okay, so that is the example. Yeah. So because now I think that is the disadvantages by using the virtual, even our conference. So I just tell you the big issue in this video is the nurse didn't recheck the patient before giving the medication. Yeah, so that is the most biggest error in this video. The others, like she didn't do the the 5 rights, the 3 reads and the 5 rights. Yeah, so especially she just take out the medication but didn't when put into the cup, she didn't recheck again. Okay, yeah. So we made 6 videos, error videos with errors, and each video have different tasks. Then we also have a standardized video to show the nurse what is the 5 rights and how to deal with the interaction. Okay, so that is just an example from me. Okay, so from the virtual OSCE, yeah, what we can do is originally we use the high fidelity simulated patients, and right now you can find down some software or develop your own virtual simulated patients. And for the standardized patient, we can use online, use ourselves as the patient, or hire some patient, some SP by just online, or ask the students to do to demonstrate the skills procedures by themselves. Okay, and one way in the literature, some schools, they use family as the SP. Yeah, like here, the father to play as a SP when the daughter at home doing the skills. Yeah, but they have to show in front of the camera. Okay, and during the pandemic, we can, like the examiners rates the students from her home. Then the SP, although because the father never received the training, so he doesn't know how to act as a patient. So the patient's voice can be replaced by like the teacher themselves, or by another SP. And the TA managers, the breakout rooms in the room, that is another, if we have many students, then we run the examination at the simultaneously. Yeah, so we need someone to handle the rooms. Okay, so
Professor, 2 minutes,
yeah?
2 minutes left, Professor.
2 minutes left. Okay, I almost finished. So here is some challenges in non-pandemic, including like a real scenario. The idealized textbook scenario may be not mimic. I'm sorry. Okay. The challenge in pandemic, there is difficulty in transferring questions to a digital format. Extra examiner and SP training. Then SP now only can help with voice, but without real expression, something like that, and some cultural issue. Okay, and here have advantages and disadvantages. I would like just to emphasize is online, it's very difficult to demonstrate a technique or devices as effectively. Yeah, such as check VP, yeah, or insulin injection. Yeah, so, and so the conclusion is the development of virtual OSCE looks like the most common strategy to replace the OSCE in person. That is, I found from the literature, and need to put much efforts to improve the ability to demonstrate the hands-on skills. Okay, and because this part is still the hands-on skills is the main task for running the OSCE. Yeah, but now we still don't know how to solve the problem, and also solve the Wi-Fi issues for some students. And also like a telephone interaction, just like me, I received so many telephone during my presentation. Yeah, so I think that is my presentation today. And thank you all of the international students. They attend the OSCE examination and also have a good evaluation to for running the OSCE. During the OSCE, it's very stressful, yeah, but I am so proud of their performance, and they also their views. They view the OSCE positively. Okay, so thank you.
All right, thank you very much for the explanation, PSDRN, for giving such as information and great speech. And yeah, Professor, I miss your class, Professor. And thank you so much, Professor, to reminder us and inspire us. What I hear, I'm forgot. When I see, I remember. What I do, I understanding. So we need to learn by doing. Thank you very much, Professor. And thank you to all the presenters for the great presentations. And we learn a lot from all of you.
Okay, we will move to the discussion session. From the Q&A in Zoom, we have 4 maybe or 2 questions. We will ask the speaker to answer the question. The first questions come from Mr. Rian Adi from Universitas Esa Unggul. This question is directly go for Professor Dr. Faridah Said. Professor, the question is, nowadays, innovation is important to all society. However, obstacles faced to many people, such as adaptation of innovation. Based on the concept of diffusion innovation, let majority population are the most percentage to avoid innovation. Could you explain or share the strategy to solve this issue, Professor?
Okay, thank you for the question. Well, why do people try to avoid something new? Or another word, why people refuse to have change? Because you want to adapt with the innovation, and if you are afraid of the innovation, that means that you don't want to have the change. So the thing is that you have to have the change. So what if you go to the concept of change? What do they need? They need to have awareness of it. Of course, they need to have the awareness on the importance of the new change, the innovation. All right. So when you create the awareness, it's not good enough. You need to go for the second level. So you want them to be adopt with the new innovation. All right. So how are they going to adopt to the new innovation? Because as we know, as I mentioned earlier on, those people like the baby boomers, they are afraid of the innovation because they are not aware of that innovation. This is something new for them. They have to go through a certain process of educating themselves, train themselves. So, but once slowly people are accepting and adopting them, you know why? There is a different strategies have been in place. The thing is that they need, in order to have them participate or to like with that innovation, we have to make sure that the innovation is user-friendly. All right. So user-friendly here means that if you look at those days, why it was not being accepted? Because the thing is that it is not a user-friendly and it is very difficult to access. So now currently is that you can see that when it is more accessible, it is more user-friendly, the acceptance of the innovation is much easier. So in other words, is that when you want them to accept the innovation, you have to create the awareness, you have to make it a user-friendly, and you have to make that innovation as part of their life, for example. So even if you look at your phone itself, so those days people still wants to have that conventional, the traditional phone. But now even the these older people would like to have the new phone, the smartphone. Am I right? So everybody wants to have a smartphone so that they can speak and see their whoever they are speaking to, especially their family members. So that is the reason why I say it must be user-friendly. It must be associated with their life, their needs of life. So then only they can accept with the innovation. All right, thank you. I hope it answered to this question.
All right, thank you, Professor, for your answering. the questions. And yeah, actually we have questions also to Professor Hasim mentioned, because we do that with Professor, we are sorry, and we will send the questions to the Professor Hasim May, and after that we'll forward to the participants who are asking about the materials. And okay, ladies and gentlemen, we are finally come to the end of the sessions. We would like to thank you so much to all the speakers for great speech, and to the participants who are for your cooperations. Hopefully this session will be benefit for us. And lastly, please give a big applause for the speaker and all of us.
Thank you.
Yeah, I'm Apriyatno Jose Alfred Mangkua. And Agni Laili Perdani, CEO. Okay, thank you, Professor.
Thank you very much for Mr. Apriyatno and Mrs. Agni Laili for leading the interactive and enthusiastic plenary session. Ladies and gentlemen, we move to the second plenary session. In this session, we will have two moderators, Mr. Tara Indra Dirgantara and Mrs. Dea Natasha. But before, I would like to briefly inform you the CV of our moderators. First moderator will be Mr. Tara Indra Dirgantara from STIKAS Sukabumi. Now, he is the lecturer in STIKAS Sukabumi, and STIKAS Sukabumi is one of our co-hosts. And for the second moderator will be Mrs. Dea Natasha, PhD. Now, she is a lecturer in Universitas Muhammadiyah Jakarta. Muhammadiyah Jakarta also our co-host. Without further ado, please welcome our moderators, Mr. Tara Indra Dirgantara and Mrs. Dea Natasha.
Good morning. Hello.
Okay, are you with me now, right?
Yes, yes.
Hey, please, time and place ensure.
Okay, thank you for the MC for introducing us as the moderator of these sessions. Good morning. Assalamualaikum warahmatullahi wabarakatuh. I'm Dea Natasha and
I am Tara Indra Dirgantara.
Yeah, we are as the moderator for the second plenary sessions of International Virtual Conference in Nursing. We are very honored to be here and welcome you in the second sessions of this conference. In this plenary, we will have two outstanding speakers from Indonesia and from the Philippines. Ladies and gentlemen, as we know that COVID-19 pandemic is an ongoing crisis that shakes the education and practice of the healthcare professional globally. So tackling the challenge in both aspects, this plenary sessions offer two topics to be learned and discussed. The first topic is envisioning healthcare transformations in post-pandemic COVID-19, and the second topic is what is the post-pandemic future for telehealth and digital health technology? Before our course, we would like to introduce you the speakers in this plenary, and the CV will be read by my partner, Mr. Tara. Time is yours.
Thank you, Mrs. Dea. Now, please allow me to read the CV of our speaker. The first speaker is Prof. Nur Salam. He is from University of Airlangga, Indonesia. I would like to read about the educational qualification. He was graduated doctoral degree in Medical Science University of Airlangga. And then for professional experiences, he is the head of nursing doctoral degree program, nursing faculty of University Airlangga. And then he's also chairman of Indonesian Leadership and Management Nursing Collegium. And also he got awards and top 17 from 500 the best researcher in Indonesia from 170,520 researchers based on Science and Technology Index was CINTAD in 2020. And he also got latest publication in Newsleet in 2020. He got three publication. Maybe you all can read all the publication. Maybe that's it's all the CV of Prof. Nur Salam. And without any further ado, please join me in welcoming our first speaker, Prof. Nur Salam.
Thank you very much. Can I start?
Okay. How are you, Prof?
Oh, fine. Thank you.
Okay, thank you. Prof, I just reminding you that you have 30 minutes and after you speak, and then maybe for the participant, if you have any question, maybe you can ask the chat in the chat room. Okay, Prof, the time is yours.
Thank you very much, Mr. Toro and Ms. Tia. Yeah. Would you please? I want to use my sharing. Just a minute. Set. Can you see this? My PowerPoint. It's okay.
Okay.
Thank you very much. Maybe I finish before 30 minutes, and remind us before 5 or 10 minutes. That will be great. Okay. Today we listen the great speakers, especially from Malaysia and also from Taiwan, and it's good things. And I learned and listened from Ms. Farida. I think that's the view, especially in transforms in health care, and also from Taiwan in Asia. That's good learn, I think. And one of the question that why we need the new technology, why we need to change, I think the question is because this is the changing process. We cannot use the the traditional technique or technology to solve the current problem. I think that's one of the questions why we need to do this one. So this one is my, you can see this one. And I think that we need to have, this one is the, we call it pelajaran COVID-19, especially our, now life is short, hidup ini pendek, so we need to invest, what kind of invest? Of course, the science, ilmu yang bermanfaat, I think that's great. And number two is our profession, our job is not everything. Number three is important thing is that we need to, the health. I think the health, the great things. So we need to survive for this one. And this one number four, of course. And the last one is we need to rely on, because transcendent to Allah Subhanahu wa Ta'ala, Tuhan Yang Maha Esa. So we need to be strong. As this one is my picture, that is not strong man, it's not others, but we need to have gives others. While although we have many problems. So this is our outline, so introduction, and then number two is envisioning. So when we are talking about envisioning, healthcare is for our vision, bagaimana melihat healthcare, pelayanan kesehatan transformation. So I try to explain on 5 things. A is about the factor driving in healthcare, and then number 2 is the transformation, and then how to solve. And I would like to focus on T&E. Here is implementation to digitalization, especially in healthcare, and how to application in nursing. This one is the E is our study in 2020 behind, so we have this one. So when we are talking about envisioning healthcare transformation, and so answering the question from to Prof. Farida, so I think we need to have a 3I, di dalam Ideathon. I think we are familiar with Ideathon. We have the 3I mean nurses need to have imagination. So we create the change we create the change. Jadi kita harus membuat suatu perubahan. It's not only involving, yeah. So we need to have the imagination. And then number two is we need to have the ideas. Ideas should be written on the paper, yeah, in explanation, yeah. So we need to do this one. And then the next one is I is implementation. So this one is, I think, our future, especially for the nurses is in Indonesia. We need to have the working for implementation for this one. So this one is our introduction that on the COVID-19 and how about the healthcare transformation in post-pandemic. And we look at here in Indonesia, I think we like keynote speaker, Bapak Erick Thohir, explain more, especially in vaccination, how to, to produce like a kind of vaccination. So this one is the great thing. So this one I just have this one for in East Java. So we have around 450 pathway for the nurses, and 259 now, sorry, 239 comes from East Java. So this one is the huge effect, especially in pandemic. So now, what's the role of healthcare during the COVID-19? I think we have four kind of things that we can for, treat 3T istilahnya, yeah, tracing, testing, and treatment. Number one, public health facility represented preparedness for the COVID. I think this one we need to facilitate for this one. And then continuing of essential non-COVID healthcare also, because we have a still number for the disease, and leverage support for managing social disruption due to, so because by this COVID is not only health crisis, but this is all aspect of the crisis, economic crisis, job crisis, and many starving people also comes, and during PPKM also we need to focus on this one. So in the last, I think in introduction that nursing during COVID, I think no fight is more great things, because we need to resilience. So resilient to be strong, yeah. So, and what's the challenging in the health? I think this one is our challenging, especially in transport for health workers. And number one is elevating health in the climate debates. And until no, like number one, number two, three, number four, and then number five, stopping infectious disease. That's important. For also we try to prepare on preparing for epidemic and also maybe endemic, because we need to still watch for the transferring for COVID-19. We have new variants now, MU variant, so we need to be alert for this one. And number two, I'm talking about envisioning healthcare. So when we are talking about envisioning, especially in COVID-19 pandemic, as a transformation catalyst, accelerating the implementation and adaptation of change. So we are always talking about the change. And some people say people will change if there is no other option. So this one, I think, is everybody we need to change. So when we change is happen, so like we have no other option. We have to change. So as a health workers, landscape continue to shift. Company face to choice transform or risk being left behind. The seeking to stay competitive must begin the journey of transformation by creating a strategy. So creating is the important thing, yeah, and focusing on single future goal. And what's the area for the healthcare transformation? I think number one is of course for prevention measure, prevention preparation. Like Bapak Presiden said, we need to prevent, yeah, especially in the new variant for endemic, yeah, in COVID. Prevention of illness to decrease the burden and social risk factors, increase the tracking system. And remote care, I think telehealth, so we can use for this one. And substantial technology dependency, the use of various artificial intelligence technology in health services, like artificial intelligence and the others. So because we face on, VUCA, we call it VUCA is volatility. The change is very fast, and then uncertainty. Uncertain. We cannot predict for the future. And the next one is complexitas and ambiguity. This one, I think, that we face why we need to prepare and why need to have a 3I for this one. So what's happened, especially in healthcare, we have a dynamic, especially in a new business, new innovation and technology. Yeah, this one, I think we need to focus on this one. Digitalization, IoT, Internet of Things, AI, artificial intelligence, machine learning, big data, and others. Like Pak Menteri, Mas Menteri said, what's the job that need for the future for Indonesia? So one of thing is a data, data analysis, product manager, IT, and the others. And number two is new competition, innovation, disruption, come on, startup, so entrepreneur, competition. New consumer is millennial and Gen Z, and new business model is like this one, platform, digital, and the others. So this one, I think, great tide of change that we have the technological change, economic and geopolitical change in mindset, and everything bring opportunities as well imagination. As I told you, we have to have three things. It's not only imagination, we have to have the idea, and then we have to have the implementation itself. So in industrial 4.0 and also for society 5.0, I think we need to keep this, I think like the problem solver. As a nurse and student of nurse, we need to have a problem solver. It's not only make a problem. The first diversity, I think we need to have this one, and decentralization. And last one is like sustainable and also resilience. So resilience is the key, how we can survive this one. Seeing the environments of occupational health, I think this one is also we can use how to prepare, especially in globalization. Like, county health rankings and also for model of population health, like health outcome here, and then we have for health factors, health behavior, clinical care, social, economic, and then physical environment. But also we need the policy, policy that we, especially for the nurses and health workers. So this one is one of the policy from the government, Ministry of Indonesia, Menteri Kesehatan. So we RPJMN, 2005. Now we have in here public, 2020, 2025, public health through quality of healthcare services has reached and is evenly disrupted by the Indonesia. So vision to be independent and justice in health community. Thing we focus on promotive and preventive. So what's the factor driving healthcare transformation? I think one of the factors we are talking about the fragmentation, fragmentation in healthcare. So focusing on acting, and this is especially without adequate appreciation, occurs when different healthcare and others. The solution is, integrated, and renew, cooperate, and the others. So how to make unite. Number two is access problem in healthcare transformation. So this one is access for the problem. So like, no remote access, and what the solution we can read for this one. I've got online, inefficient and error in data sharing, go for blockchain based data and the others. Unsustainable cost in health transformation, I think this one is also our problem, especially in health workers. Delaying incentive, jadi banyak para perawat, tenaga kesehatan lain yang insentifnya mundur ya, ditunda ya, belum menerima. Kemudian ada limited health facilities like kelangkaan oksigen dan the others previously, so this one has become the problem. Disparities in health transformation. Ya, jadi ini disparities are driven by social and economic. So I think we now face for this problem. Next one is about healthcare transformation. We have six things like, enhanced knowledge. So what's knowledge, skill, and this one. And then also this one is for what we need the nurse, especially for nurse in the future. This one is the result of the study that we need to have the initiative, we have to integrity, and that we have to have a critical thinkers. This one is studied in Britain, United States, and Canada. Focusing on wellness. So shifts from care is it that's focusing on illness and wellness and prevention. So I think this one is very important for us to develop on this one. And then, of course, in line with SNARS and also for cars, and especially in the hospital. So now we have goods focusing on patient center. So we have a patient center care, holistic care. So we can, create innovation in holistic care, quality also in motivational and interviewing. And also, of course, core coordination. Now we have a strategy in, interprofessional collaboration. All nurses, no matter what their role, must practice care coordination. I think this one is important. Sometimes this one is our lack of, especially in the nursing services. Surveillance system and data, I think that's the problem our, especially in Indonesia. We remember previously we used for like when we were going to flights, we need to show some data, but now change also ya. Dulunya pakai e-health ya, sekarang kita pakai peduli ya, lindungi peduli. So this one the example from this one, quality improvement, how patient satisfaction. I think this one is our challenging for the future. So this was the result how the patient perception in, especially for development for this one. So that's why we have a essential element how to satisfy the patient, especially for doing for communication. So to solve facing new realities, most people have different way of seeing, thinking, and acting. So this one is digital. Yeah, I think in healthcare, patient wants on-demand healthcare. And also reality helps doctor and get better training, artificial intelligence, and the others. Okay, this is the point. Creativity is the new economy, and spirituality is the new paradigm. So we can use for this one as a good thing. Technology development is very needed. I think this one is provide digitalization. I'm not repeating, but I just stressing here. Citizen open up many channels, especially for reading online newspapers, new magazines. This one the top. So we usually use the reference for this one, and this one is our opportunity and challenging. I think we need to address on this one. But now T, implementation digitalization for health in COVID. This one the example for 3I, Idiotom ya, di Idiotom nanti Anda bisa melihat like Pak Erick Thohir says, like this one is Idiotom from Ayu Jati ya, Sekolah Teknologi Nuker, pemenang Idiotom 2020. Respiratory rate, oxygen saturation ya, SPO3 monitoring system, oxygen regulator control system with Internet of Things. Ya, ini yang mungkin menjadi imagination kita, mimpi kita, inspirasi, ide, implementasi ya. Ini juga yang kedua adalah Apriani Toding dari Universitas Kristen Indonesia, pemenang Idiotom yang di sana inspiration, idea, dan sasaran, so implementation. Implementation, pembuatan modul teknologi. So modul is also for the new, the new innovation. And also this one from ITS for design of the Android-based mobile application, curhatin on a psychological consultation. So many people stress because of the COVID, and then curhatin. So curhati pentingnya menjaga kesehatan mental. And then idenya adalah membuat aplikasi layanan psikologi curhatan. And then this one is how to implement. And then this one is from Indonesia Telkom, mobile sales application for IT application in maintaining the economy. So this one is the example of Idiotom we can use for this one, we can learn. And this is the example, especially in nursing. This is my example from this one. So digital transformation, we have like this one, we focus on telenursing. And I think this telenursing is, has been, explained for the whole, all of it. I'm not going to do this one, but at least in telenursing is reduce maintenance cost, reducing hospital stay, scheduled visit, increasing the number of coverage, across distribution, and also improving the quality of services. So this one I think we can use now. So now we are going to design.
Sorry, sir.
5
Your time
minutes?
is 5 more minutes.
Okay, thank you. Thank you very much. Yeah. So I encourage for participants, especially for the nurses, to do for like transforming in innovation by using 5-6 steps here. Yeah, like data collection, development, until dissemination and recommendation. This one in the example that my product, especially in development of digital training on application based on transaction theory of STEMI's client. So we make it for health worker in providing education and monitoring. I think this small thing that we can use for this one. This one is the application. Ya. Jadi ini aplikasi yang bisa digunakan. You can use for this one. The simple thing by Android. Number 2 is we thought this one for Alisa. We call Alisa. I got SIM Tap Mas 3 years, 3 tahun. Tahun pertama, tahun kedua, and we use for this one. For Android, yeah, using this one. So I think that's interesting. We can monitor and can remain for this one. This one is the example for Timba for Alisa. Okay, this one we can count for, like Fruit, others. And also. Number 3 is development of very operative for nursing instrument based on 3S, ya, SDKI, SLKI, SIGI. Nah, ini use the instrument, bagaimana menyusun suatu instrumen di kamar operasi based on SDKI and others. So this one is you can use also, you can look at in Scopus article, what's kind of development especially that we has already here. What's the implementation, what is the new instrument and others. And you can use for like this one, instrument development, yeah. Like this one, when we are talking about innovation, this one is including innovation. But when you use for innovation, one of the thing we can use for R&D. And also the last example is for education, basic of ECG algorithm. So design interpretation based Android application for the nurses. We call the name is EC. Application can use in nursing intervention and make nursing task easier, digitalization, and the others thing we can use for this one. So I think that the whole thing, my conclusion is we have where we are now. So di mana kita sekarang, I think. The next one, where we want to, and how to get there, and then how to stay there. So this one, I think, this good thing. Maybe participant has watch for startup in Korean, Korean drama. So you can just like startup like it. Developing professional image, I think the most important thing, and we need to strengthen the character of each individual, and like this one, build in professional branding. So we need to branding, yeah. We need to strengthen the nursing organization as well, and the others. Okay, the existence of nursing in post-pandemic, I think we need to have 6 E's. We have to show environmental survey. Look at the survey changing. Yeah? Excellency, eclecticism, enthusiasm, effort, and endurance. Okay, this one is the most people say you don't have to quit to get started, but you have to study to be great. Okay, thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Prof. Nur Salam, for giving such informative and comprehensive speech. I think there's a lot of things you want to say to us, but we are running at time. Okay. Now we are going to start the second speech with the topic, the post-pandemic future for telehealth and digital health technology. And the speaker CV will be read by Mrs. Dea. Please, Mrs. Dea.
Mrs. Dea, I think you mute.
Okay. Yeah, okay. Sorry. Thank you. Okay. We have learned so many effort in research to conduct health transformations program from Professor Nur Salam in Indonesia. Now we are moving to the Philippines. It's a privilege to have Dr. Maria Elizabeth with us, and soon will be delivered the topic about telehealth and also digital health technology. Before we start, I would like to read her CV. Dr. Maria Elizabeth educational qualifications. She received her PhD in nursing from St. Paul University in the Philippines, and she is currently as an associate professor at the St. Paul University in the Philippines. And Dr. Maria Elizabeth currently as the program coordinators of the doctoral program at that university. She also a member of Nursing Accreditation Associations in the Philippines and also the executive committee of the EVONS. On the top of that, she had a long list of publications and projects, and the most recent publication was related to the theory of mindfulness caring in community health, which published on International Journal of Community Medicine and Public Health. So without further ado, please join me in welcoming our speaker, Dr. Maria Elizabeth.
Thank you so much. Thank you so much to the organizers of the 5th International Conference in Nursing. And of course, thank you to our moderators, Dea and Tara. So I would like to start with the first slide, please. Shall you operate my slide? Okay, so the topic that was tasked for me to discuss is the future of telehealth and digital health technologies post-pandemic. Next slide. So I would like to pose these questions to everybody. How many times have you heard it said that the internet will transform modern life after the pandemic? How did the internet change how you stay in touch with family and friends, purchasing goods and services, and even search for information about health problems? Are we aware that a variety of telehealth tools are available for us to manage healthcare and receive the services we need? Are we taking advantage of them? Healthcare is being reshaped by the COVID-19 pandemic, and we answer some of the most pressing questions on the state of the industry and what to expect in the future. So the question is, what is the future of digital health technology post-pandemic? Next slide. So there are a lot of digital tools that has come around during this time of the pandemic. And we have utilized some of them during the pandemic preparedness and response. So what is the digital technology in healthcare? So this is also called connected health and technology-enabled care, which involves the convergence of health technology digital media, and mobile devices. It enables patients, nurses, and healthcare professionals to access data and information more easily to improve quality and outcomes of health and social care. So what are the available technology that we use in healthcare? So we are familiar with digital healthcare technologies such as artificial intelligence, telehealth, telemedicine, 3D printing, robotics, or nanotechnology. Next slide. Digital technologies are being used to improve health information systems from the community level to district, national, and even global levels. Their use also improves the timeliness and accuracy of public health data collection and reporting and facilitates disease monitoring and surveillance. Next slide. So healthcare is being reshaped by the COVID-19 pandemic. And we would like to explore some questions in the state of the healthcare industry and what we expect to become with us in the near future. There are emerging trends within healthcare that are being accelerated by efforts to combat the coronavirus pandemic, whether it's telehealth, infectious disease mitigation, or mental health. There is a renewed focus on startups looking to tackle challenges of healthcare accessibility and effectiveness. Next slide. So what are the purposes of digital health? So it is broad, multidisciplinary concept that includes concepts that intersect between technology and healthcare. It also improves our ability to accurately diagnose and treat diseases and to enhance the delivery of healthcare. Digital health technologies use computing platforms, connectivity, software, and sensors for healthcare and related uses. Next slide. So what are the common uses of digital technologies in relation to searching medical knowledge? So it facilitates clinical support. You can monitor quality of care. You can map and monitor the spread of infectious diseases, and as well as track supplies of drugs and vaccines. Moreover, there are tens of thousands of healthcare practitioners using digital health technologies, so improve patient care outcomes and healthcare providers. Next. So digital health includes many applications. So here are the applications. So we have electronic health records, electronic medical records, wearable devices, telehealth and telemedicine, as well as personalized medicine. And these were explained to us by the earlier speakers. So it has become, digital technology has become integral part of healthcare, and it has revolutionized the practice of medicine and nursing. It has improved operational efficiency with respect to standards of medical care. Some of the areas where digital technology has made enormous impact are the following. It improved access to medical information and data. So it has the ability to store and access data. Healthcare professionals can now retrieve patient data from anywhere. Using the intranet and intranet, it allowed healthcare professionals to share medical information rapidly with each other, resulting in a more efficient patient care. Next. So next is big data. So it allows for the instant collection of data from a much diverse and larger population than ever before. Such data collection allows for meta-analysis and permits healthcare professionals to stay on top of cutting-edge techniques and trends. So it allows clinicians to identify risk factors and recommend appropriate intervention steps more effectively. Next slide. So other digital technologies includes EHR, or the electronic health records, and it has improved lines of communication. So this technology has improved access of patient medical records. So it's easier to retrieve the medical health records of our patients. Its portability has increased, and it enables a faster, smoother, and easier medical billing. So it also improved the lines of communication. So we can use, medical professionals can use or do their own webinars, videos, and online platforms and social media to communicate with other professionals. So like teleconferencing, it has made easy to communicate beyond geographic borders. Next slide. Other health apps like telehealth and telemedicine, which I will discuss earlier. And then it has facilitated online education. So more students are using several applications, several online gadgets for them to be able to attend school. And then many applications have resulted for the development of these applications and made more patients and practitioners to monitor their health and disease, their health conditions and diseases, and provided them information about their diseases. Next slide. So what is telehealth? Okay. Telehealth is the use of digital information and communication technologies such as computers and mobile devices to access healthcare services remotely and manage your own healthcare. These may be technologies that we can use from home and that your doctor uses to improve and support healthcare services. Next slide. So what are the ways in which telehealth could help us? So you can use your mobile phones and other devices to upload medications, your doses, your blood sugar levels, and nurses and doctors can respond to you very quickly, and this is done electronically. So you can watch a video on a particular carbohydrate counting or download an application. You can do that using your Android phones. Use an application to base your diet and exercise and how much insulin you need. Use an online patient portal to use your test results, schedule appointments, request prescription refills, or email your doctor. And you can order medications online through pharmaceutical tests. You can use your mobile retinal photo screening at your doctor's office rather than going for a schedule or an appointment to a specialist. Then you get emails or phone reminders so that you get reminded of your medications or flu shots and other preventive care. Next slide. So what are the goals? So it makes healthcare accessible. It makes services easier and available. It's more convenient, and it provides access to medical specialists. It improves communication and coordination of care, and it provides support for self-management of healthcare. Next slide. So telehealth services include patient portals where you can communicate with your doctor or nurse. You can request prescription refills, review tests, schedule appointments, or request appointment reminders. Next slide. Other virtual appointments. So you can set a virtual appointment with your doctor via online using teleconferencing. Next slide. Drawbacks. Okay, so sometimes there are disadvantages. You may treatments may not be properly coordinated with your regular physician. Information may not be considered, and then decision making may be too complex. And then there is a problem with evaluation. Next slide. Remote monitoring. So web-based or mobile apps for uploading information. Like for example, you would like to know your blood glucose readings so that you can refer to your doctor. So there are wearable devices that we can do. So like we have iWatch for us to provide information such as blood pressure, blood glucose, or your ideal body weights. Next slide. Doctors, talking to doctors. So it's very easy to refer a patient to another specialist, with the use of devices and digital technology. So they can respond electronically by conducting a virtual appointment. either at the doctor's office or at the hospital, or you may also request a face-to-face meeting. Next slide. So there is no rush for you to travel. So we have the EHR, or the electronic health record. So it's very easy to retrieve the patient's data. So it's a collection of information about the health of your patient, how it is controlled and maintained, and it is accessible anytime using a web-based device such as computer, laptops, or tablets and smartphones. Next slide. So this is the electronic patient data. So there are several levels that we can use. So we have the AMR, the electronic medical record, the electronic patient's record, and the electronic health record of the patient, which is very accessible. And these are accessible and can be retrieved using any web-based digital technology. Next slide. So personal apps, so of course we have a multitude of apps that we can use. These are digital tools that help us to store health information, record vital signs, calculate and track caloric intake, schedule reminders for taking medicine, record physical activities, and many more. Next. So potentials, of course, of telehealth. It has the potential to improve quality of healthcare, and it's very accessible. And telehealth may provide opportunities to make healthcare more efficient, better coordinated, and closer to home. And of course, research about telehealth is still under process. But it is growing. Next slide. Advancing technologies can fuel digital healthcare revolution. So a revolution in the future, we are experiencing a revolution in digital healthcare. And it's fueled by advanced technologies such as virtual, augmented reality, advanced analytics, and AI. Next slide. So an example is the eHealth Connect, wherein the patient, based on whatever digital technologies he has direct access and can connect through internet and internet web-based services with patient medical records, medical data storage, and sensor message partner can be communicated very easily to her immediate primary physician, so that the physician can monitor using many applications and analytic applications that are available, so that the physician and the patient can work hand in hand in the monitoring of the patient's health and condition. Next slide. So future digital technologies post-pandemic. So it is currently positioned to generate buy-in from those otherwise may not have experimented it. So it applies to multiple healthcare fronts, including consumer side, provider side, and payer side. However, when we emerge from this pandemic, we have to recalibrate its uses, no? We have to revisit its uses. So we have to adapt to increase above pre-pandemic levels. As more payers and providers expand their offerings, patient embrace technology, and more startups expand their presence in the space. But in the near term, there are more finer points to consider, like reimbursement and credentialing. Next slide. So this is a proposed framework, no, on how we can utilize extensively telehealth, medical devices, digital health services, improve women's health and mental health, and regenerative disease medicine, so that we can use startups to focus specifically on what healthcare products can be very useful for us, especially the patients and the consumers, like our health professionals. Next slide. So what does WHO say about digital health? So it's a 3-year approach in terms of digital health delivery. So for policy makers, support decision makers at the local, regional, and national level to ensure sustainable, safe, and ethical use of technology. For practitioners, facilitate the capacity for practice to use the digital technologies to deliver healthcare benefits effectively, and for the population to improve the health and well-being of people with the interventions of digital health. Next slide. So the WHO has recommended the global strategy on digital health from 2020 to 2025. So the purpose is to promote healthy lives and well-being for everyone, everywhere, at all ages. To deliver its potential, national or regional digital health initiatives must be guided by a robust strategy that integrates financial, organizational, human, and technological resources. Next slide. So for my conclusion, the COVID-19 has caused monumental disruption to healthcare delivery, and caregivers face unprecedented levels of uncertainty, both the people they care for and for their own health and well-being. But many carers face poor health and well-being, and there is a significant risk that health inequalities will be increasing after this pandemic. So that's why it is recommended that innovations such as digital health could make a significant difference based on careful planning and implementation. And this is very important for widespread implementation. Next slide. Last slide, please. So the use and scale up of, let's go back to the last slide, of digital health solutions can revolutionize how people worldwide can achieve higher standards of health and access of services to promote and protect their health and well-being. So digital health technologies provides opportunities to accelerate our progress in attaining health and well-being based on the Sustainable Development Goals, as articulated in the 13th General Program of Work. And WHO will focus on enabling countries to plan, adapt, and benefit from seamless and secure technologies that provide effective clinical and public health solutions to accelerate the achievement of health and well-being in relation to the Sustainable Development Goals. So this means leaving no one behind, children or adults, rural or urban, with the use of digital solutions to improve health and well-being. Thank you so much. These are my references. And hatur nuhun. Thank
Hatur
you.
nuhun. Yeah, hatur
Yes.
nuhun. Thank you,
Hatur nuhun.
Professor. Hatur nuhun. Okay, thank you very much, Dr. Maria, for giving such informative and very comprehensive speech to complete our learning of digital technology and also the integrations in the healthcare. Now we are going to have a discussion session, which be led by my partner, Mr. Tara. Time is yours.
Okay, thank you, Mrs. Dea. We have many questions for Mr. Prof. Nur Salam and Bob Maria, Mr. Maria. I will pick one question maybe. Hold on. This is from Ian Riani from University of Pajajaran. The question for Prof. Nur Salam. This is two questions. The first is, how much are affect high technology in pandemic for children? And the second one is, how can we comparative nursing intervention application and high technology for our children? Maybe that's the question, Prof.
Thank you very much, Mr. Toro. I think that how much the effect of in the children, especially during this pandemic, when we are talking about children, now we found many Indonesian children, especially under 12, yeah, maybe as more 12 also, addicted with the technology, especially game online and others. So this one is I think is the effect. And talking about the technology, especially related to the treatment for the children, I think also this is many studies on that has the side effect, but we still weigh the useful is greater than the bad effect. So we choose one as one. Number two is how can intervention, especially on the technology. So I think when we are focused on pediatric area, we need to have many strategies, especially for looking after for the children with the sick, because sometimes the children, when we use for investing for the technology, usually become fear, anxiety, crying, and the others. So we need to have a good on approaching, good communication, encouraging. So you know, sit down and decide the children. I think that's fine. Number two, we need to also make sure that the technology, especially the intervention using this one, is should be encouraging the family and the mother, especially as her mother or his mother, to to understand, to involve in the treatment itself. So I think it will help the student and the children will cooperate to the intervention as well. And of course, we try to make the technology, especially caring for the child, which we call is in Indonesia. I have abbreviation for SMA. SMAs should be standard, jadi harus sesuai dengan standarnya. M is easy, mudah diterapkan. E is effective and efficient. So short time you need to to predict as well, so that not make frightened for the children as well. So this is my answer, Mr. Toro.
Yeah, thank you, Rob, for your answer. And then, do we have still time, Mrs. Dea?
Yes, I think we have one more question.
Okay, one more question. Okay, we pick up for hold on.
From Miss Anastasia Anna.
Okay, you can.
Yes, she would like to ask to Dr. Maria. She said that it's very excellent and inspiring presentations, and the concern is in the digital technology era, how to prepare nursing students to be able to face the advance in the digital technology in the future.
Okay, yeah, that's a good question. How can you prepare nursing students to be able to face the advancing technology in the future? So we have in the curriculum for nursing, before they take the nursing care management courses in the curriculum, they have to take minor courses on nursing informatics and digital technologies. So that when they are already in the practice area or in the playing fields, they are going to utilize this digital or adopt digital technologies so that they can integrate them in healthcare or in patient care. So these digital technologies can only provide us a framework for us to be able to facilitate the use, the improvement, and improvement of healthcare outcomes to our patients using digital technologies because of the pandemic. So this will make us lesser contact with our patients using the digital technologies. However, of course, using these technologies will we have to make it in mind that we should not lose the value of caring to our patients. So that's why in the use of digital technologies, we also include the concept of caring as a value, no? A sustained value in nursing, so that even in the use of digital technologies in healthcare, we do not lose that caring behavior as we take care of our patients, even virtually. Okay, so I hope that answers the question. Thank you.
Okay, thank you, Professor Maria and also Professor Nur Salam. Ladies and gentlemen, we finally come to the end part of this event, and I would like to make a little summary as a take-home message what we have learned from the two outstanding speakers today. So considering COVID-19 as a catalyst of digital transformations, the most ability to learn and maintain is resilience in order to survive in the rapid and uncertain conditions challenged by COVID-19. Then we can adapt well, improve our ability, and also create innovation using digital technology in order to restructure the better healthcare system. On behalf of Kamnita, I would like to thank you all of the speakers for the fabulous talk today, and also thank to all participants for the fruitful discussion. I'm Dea Natasha and also Mr. Tara Indra. Yes, we are going to say goodbye, and the next session will be taken over by Master of Ceremony. Thank you.
Thank you very much.
Thank you very much for Mr. Tara Indra Dirgantara and Mrs. Dea Natasha, who had led insightful second plenary session. Ladies and gentlemen, now we are going to start plenary session 3. But beforehand, we will show company profile video from Universitas Lambung Mangkurat, Poltekkes Karya Husada Yogyakarta, and also another video from our poster presentation.
Faculty of Medicine, Universitas Lambung Mangkurat, was founded in 1989. 19 years later, in 2008, the School of Nursing was established under the Faculty of Medicine. The noble goal of the School of Nursing is to develop nursing science in order to produce a professional nurse and public-oriented. The other goal of the School of Nursing is to organize higher education program that qualified, efficient, and responsive to the community. Besides that, to increase the implementation of nursing research and technology through community service to increase the community quality of life. Thus, the School of Nursing could produce graduates who have the expertise or special skills and competencies in the implementation and development of nursing science and technology.
School of Nursing, Faculty of Medicine, Universitas Lambung Mangkurat has a vision to become a leading and competitive study program in knowledge and technology of the nursing field, which is oriented towards the wetland environment in 2023. In order to actualize the vision, School of Nursing, Faculty of Medicine, Universitas Lambung Mangkurat developed the mission as follows: to organize professional education with national standards to produce qualified and leading human resources in nursing in a wetland environment, to conduct nursing research based on science and technology in a wetland environment, participate in the science implementation in community services and community involvement in the accordance of nursing. And last, to increase the cooperation with other universities, including public and private universities, to support education, research, and community service.
School of Nursing has units to support 3 Dharma activities, that is, Nurse Education Unit, or NEU, is a coordinator in planning, assessing, developing, monitoring, and internal evaluating towards curriculum, teaching and learning process, lecturer instructional skills, and academic infrastructure in the School of Nursing. NEU consists of 2 divisions or subunits to support academic activities that are Skills Lab or OSCE and the Tutorial or BBM division. Nurse Profession Education Program Unit. Nurse Profession Education Program is implemented in the 5th year after the students complete the academic stage. The program could be completed in 1 year with 36 credits. The program consists of a basic nursing stage, medical nursing stage, pediatric nursing stage, maternity nursing stage, critical nursing stage, emergency nursing stage, mental health nursing stage, management nursing stage, family nursing stage, gerontological nursing stage, community nursing stage, wetland health nursing stage, and thesis. Student Affairs Unit is a coordinator in providing guidance, consultation, achievement, and assistance for student activities. Research and Community Service Unit. Research and Community Service Unit has functions to coordinate, monitor, and assess the implementations of research and community service activities organized by lecturers and students. In addition, as a method of a coordination and implementation of student thesis in the School of Nursing. Public Relations and Cooperation Unit. Public Relations and Cooperation Unit to support the implementation of cooperation and management of information publications and work programs of School of Nursing, whether regional, national, or international. Journal and Publication Unit to assist the smooth operation of publishing scientific publications to increase the quality and quantity of scientific publications for lecturers and students, both journals and textbooks, and to register the copyright or patent through training, workshops, or other activities. Quality Assurance Unit to perform internal quality assurance in School of Nursing, including providing the manual procedures, work instructions based on academic standards, and quality objectives of School of Nursing, compile academic or nurse profession education self-evaluation reports. Information Computer and Technology Unit, or ICT, to compile plans, coordinate, evaluate, and develop information systems, computer, and technology. Besides, the ICT unit also organizes the nurse competency tests for School of Nursing quality improvement. Counseling and Career Development Unit. Counseling and Career Development Unit coordinates in providing counseling and career guidance services to students related to problems that are obstacles in academic and nurse profession education. The services could be individual or group counseling. School of Nursing, Faculty of Medicine, Universitas Lambung Mangkurat become a leading and competitive school of nursing in Indonesia.
Politeknik Kesehatan Karya Husada Yogyakarta beralamat di Jalan Tentara Rakyat Mataram Yogyakarta nomor 11B telah terbukti berhasil membentuk tenaga profesional di bidang medis melalui jenjang pendidikan Diploma 3 Kebidanan, Diploma 3 Keperawatan, dan Sarjana Terapan Promosi Kesehatan. Berbagai keunggulan seperti pembelajaran teknologi informasi, terapi komplementer, penanganan gawat darurat, dan promosi kesehatan bencana. Politeknik Kesehatan Karya Husada Yogyakarta juga dilengkapi fasilitas penunjang yaitu perpustakaan yang nyaman, laboratorium kebidanan, keperawatan, dan laboratorium pembuatan media promosi kesehatan. Tunggu apa lagi? Ayo segera daftar dan wujudkan cita-cita menjadi tenaga kesehatan atau tenaga promosi kesehatan yang profesional bersama Politeknik Kesehatan Karya Husada Yogyakarta.
keluar dong. Oh, enggak. Ada di
All of the audience, here we are, the plenary session 3. And in this session, Mr. Agianto and Ms. Henny Purnama are going to be moderators. Would like read CP. Mr. Agianto as Nurse MNS PhD. He is Doctor Nursing from Faculty of Nursing, Khon Kaen University, Thailand. Master Nursing, Adult Health Nursing, Faculty of Nursing, Khon Kaen University, Thailand. Professional experiences, Director of School of Nursing, Faculty Medicine, Universitas Lambung Mangkurat. Member Institutional Review Board, Komisi Etik Penelitian Kesehatan, Faculty of Medicine, ULM. Reviewer Caring, Indonesia Journal of Nursing Science. Latest publication, kepuasan perawat dalam penggunaan website, screening Dysphagia, dunia keperawatan. And the second moderators, Ms. Henny Purnama MNS, Lecturer Stikap PPNI Jawa Barat, Educational Qualification Master of Nursing Science, Kasartat University Bangkok, Thailand. Award and Achievement, the winner of PKMK as a supervisor, Indonesia Government Scholarship 2017, short course in Field Health Science in Taiwan. Late publication, rise of cardiovascular disease among HIV positive individual using BMI, best framing risk score in Indonesia. Without any further ado, please welcome Mr. Agianto and Ms. Henny Purnama.
Thank you very much for the
Mr. Agianto, please, time and place is yours.
All right, thank you very much, MCs, to invite me as moderator. Hello, everyone. Good afternoon. Now in Banjarmasin is afternoon already. I'm Agianto. I'm from Universitas Lambung Mangkurat. So this is a great honor for me to be the moderator for this international conference. And of course, I'm not alone because I have partnered to be moderator today. And she's Miss Henny. Hello, Miss Henny.
Hi, everyone. Hello, Mr. Agi. Selamat siang. How are you?
Yes, I'm very well, thanks. And I hope you are doing good in this afternoon in Bandung.
Yes, I'm from Bandung. So this is Bandung, between Bandung and
Banjarmasin.
Banjarmasin. Okay.
Yes, it's too far. But in this conference, it looked like to short distance, right?
Yeah.
All right. Now we are in the third plenary session, so it's already the last session, I guess, right? In this conference, and hopefully our audience is not bored because we still have 2 speakers left, and they're also very amazing speakers from UK as well as from Indonesia.
Wow.
And of course, we this is very interesting topics. So we will have Mrs. Winnie Handiani, MK PhD candidate. She will deliver the title with Adolescent Empowerment for Smoking Prevention during pandemic. And after that, we continue to the next speaker. He is from UK so far from here. Mr. Theodore Sticky, PhD MA. He is from Division of Nursing, University of Nottingham. Well, Ms. Henny, could you like to read the CV of our first speaker, Mrs. Winnie Handiani?
Yes, for sure. I will briefly read for you and for all of the participants about the speaker. The full name is Mrs. Winnie Handiani. She is a member of Stikap PPNI Jawa Barat, and now her pursuing her doctoral degree in Lincoln University, Malaysia. And the latest publication in 2021, Translation and Culture Adaptation of Problem and Need of Palliative Care Questionnaire for Use in Older People in Indonesia. Yeah, this is from Indonesia and from Stika PPNI Jawa Barat. So, Mr. Agi, without further ado, please welcome Mrs. Winnie Hadiani.
Hello, good afternoon, Mrs. Winnie.
Good afternoon, Mr. Agi.
How are you doing there?
I good today.
Nice, very
Okay.
great. Of course, today we will have you to hear your sharing, your experience, and also knowledge. This is very interesting topic, I think. And we will hear you because you will present about the adolescent empowerment program for smoking prevention during this pandemic, right?
Yes.
Isn't it?
Okay.
Okay.
Yes, it's right.
I'd like to remind you that you have 30 minutes for presentation. And after that, we will continue for the next presenter. And the last session, we will have discussion about 10 or 15 minutes, something like that.
Okay.
All right, Mrs.
All right.
Winnie,
Thank you, Mr.
time is
Agianto.
yours, please. Thank you.
Okay. Can I share?
Yes, of course.
Okay. This my PowerPoint is there.
Yes, we see it.
Okay. My voice is clearly.
Yeah.
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. Thank you to everyone one of you for being here today at this conference. My name is Winnie Hadiani. I'm from Stika PPNI Jabar. It is such an honor for me to speak at this fifth conference that conducted Stika PPNI Jabar. Before we get started, I would like to express my appreciation to the committee and all participants. Today's conference, I would share about empowerment adolescents during COVID-19, especially adolescent smoker. Okay, you can see the picture. This is the impact of the COVID-19 pandemic. This picture shows the situation when the area restrictions were initially imposed in Indonesia. And I think pandemic conditions have caused changes not only in Indonesia, but throughout the world. The COVID-19 pandemic represents a massive impact on human health, causing sudden lifestyle change to social distancing and isolation at home with social and economic consequences. And more, government have responded to COVID-19 pandemic by advising the public to stay at home and avoid unnecessary social contact. And you can see this circle, the pandemic consequences. In this circle, the picture shows the consequences that occur in pandemic COVID-19. This circle shows us that physical inactivity triggered by COVID-19 negatively influence people's quality of life and well-being. To reduce the spread of COVID-19 has an impact. There is a lockdown. It has provoked physical inactivity, which can cause worse nutrition, like overweight, smoker, or sedentary psychosocial problem, and etc. We know the smoker in Indonesia during pandemic. The smoker in Indonesia are a matter of concern because there is always an increase in smoker although in pandemic COVID-19. Several studies have shown the relationship between smoking history and the development of symptoms of COVID-19 disease. The National Commission for Tobacco Control surveyed 612 participants for various regions in Indonesia from May to June 2020. Most participants increased cigarette consumption time is 69.77% during region restriction. Is Indonesia, our Indonesia, always increase in smoker. Then adolescent smoker in Indonesia, we know is always increase year to year. Besides that, we know the empowerment adolescent is health promotion program recommended by UNICEF, and we have expected empowerment adolescent to be able to reduce the incidence of smoking among adolescents. What is empowerment adolescent? Empowerment adolescent is a multi-dimensional construct shared by many disciplines, including human rights, gender, education, health, protection, psychology, and economic. And UNICEF said adolescent empowerment is journey during which an adolescent age 10 to 19 to increase accept, critical awareness, development a clear and empowering understanding of themselves, their right and opportunity in the world around them, and to increase agency and voice and participation, have the power to make personal and public choices for the improvement. Okay, this is empowerment journey. This picture show about empowerment journey. You can see the asset and then critical awareness and agency, and the last voice and the participation. Yeah, they are taken together, enhance adolescent ability to make informed choices and negotiate a safe transition to adulthood. Okay, the asset. This meaning is a valuable thing related to what an adolescent can do or be that can be used to reduce vulnerability and expand opportunity. And the critical awareness is referred to active, persistent, and careful consideration of belief or type knowledge, including one identity and right as enshrined in human rights framework such as Convention on the Child Right. And agency means the personal capability to act and make free and informed choice to pursue a specific goal. And the last, voice and participation. Voice means the ability and confidence to articulate thought and emotion. And participation refers to adolescent individually or collectively from the expressing their view and influencing matters that concern them directly and indirectly. And this is reflect key characteristic of this empowerment journey. The first, a shift of power from less for more, and accumulation and evaluation of the four components over time and across adolescence, and the inherent role of the broader empowerment such as norms, institutions, and policies. And the second, empowerment results from the intersection of the above four overlapping and complementary components. And third, underlying this component is the broader enabling environment to support and realize empowerment. The fourth, effort to transport the structure, institution, and dynamic which reinforce the preferred inequality and can positively support and accelerate the empowerment journey. Okay, and this is UNICEF has identified 4 key components to support adolescents along their empowerment journey. These components are the first, promoting realization, access, and use of assets, which include skill building for accessing and utilizing this asset. And the second, increase critical awareness, and then fostering agency, and the last, enhancing opportunity for voice and participation. Okay, this is research we have done related to adolescent empowerment during pandemic COVID-19. The first, our research was about empowerment program to address behavior among adolescents. This research was conducted at the beginning of the pandemic as a literature review to determine the empowerment program toward adolescent risk behavior. We collected the article from database PubMed and Google Scholar. The article were searched from 2017 until 2020. We used the following combination to search title, abstract, and keywords like empowerment and adolescent or youth and behaviorist or smoking or sexual or drug or HIV. And finally, we have 5 selected articles we included in this review through the GBI assessment process. Okay, the article of adolescent empowerment were carried out in various countries, which are Iran, Zambia, Nicaragua, and 2 articles in Michigan. Based on this study, okay, I think in this PPT, based on this study, empowerment has a positive impact, on smoking prevention, sexual and reproductive health, HIV, drug abuse, and adolescent can influence publics. And we found the empowerment program article have the same program empowerment. They are the first, every articles reinforcement of knowledge to adolescent, and then form in small group so that it's need peer collaboration. And the third, we found opportunity for self-development. And the last, empowerment program embedded in organization and other programs. Okay, this is the second study. Our second study. The relationship between empowerment and self-efficacy among adolescent smokers. We did this study in early 2021 during the pandemic. We know that self-efficacy is a person belief in his ability. According to several studies, they have shown the self-efficacy can affect adolescent intention to quit smoking. So we insisted in researching to see the relationship between empowerment and self-efficacy. Okay, this study was conducted on 80 adolescent smoker and the age group to 15 and 18 years, and that's the means is 16.26 and the standard deviation is 0.866. The first time smoke in junior high school is 58.8% and have smoked more than 20 cigarettes per day for 36.3%. This is a characteristic respondent in our study. And the questionnaire used the determine adolescent empowerment is the youth Group Member Survey, or YGMS, by Holden 2005. This questionnaire was used to measure psychological impairment for tobacco control, and this questionnaire consists of 6 domains, namely specific effect and perceived social control, participatory participation, knowledge resources, assertiveness, and advocacy. Okay, the result. Oh, the one questionnaire again. The one questionnaire, I'm sorry. The one questionnaire is smoking self-efficacy, questionnaire 12. This questionnaire had 2 domains, namely internal stimuli and external stimuli, and measure the person confidently not to smoke in risk situation. Okay, this is the result. The result, the first adolescent impairment was this means 38.83 with a standard deviation of 5.274. The minimum value was 24 and the maximum value was 15. The second result, perceived social control domain had the highest score compared to other domain, while advocacy is domain that had the low score. In this case, adolescents have confidence in their ability to play an active role in the social environment and try to have a role in problem solving. But it's difficult for young people or for adolescents to have the ability to influence policymakers. And the third result, the result of described self-efficacy among adolescents explain that internal stimuli and external stimuli has almost the same mean. And the last result, based on the research result, there is a significant relationship between adolescent impairment and self-efficacy with p-value 0.01 with p-value 0 and 0, I'm sorry, 0.01, but with a coefficient relation 0.35, which indicate a low level correlation. Okay. I'm sorry, my PPT is not moved. Okay. The third reset. The third reset is effect of adolescent empowerment toward smoking behavior and self-efficacy of adolescent smoker. This research used quasi-experiment with 2 groups and pre-post test design. Okay. Participant is 60 adolescent smoker, and questionnaire we use JNSBQ and SAQ-12, and the procedure. Okay, the procedure, the research couldn't be done direct, and we know this is pandemic, and we use social media to treatment and measure the variable. The procedure, the first, all participants we give a module in the baseline, and then after that they were divided into 2 groups through a random sampling process, and both groups consist the 30 participants. The intervention group was divided to 5 group WhatsApp group, and they have guided by 1 facilitator and given the some treatment. This is the treatment. Okay. The first, the intervention group was given, or the treatment group was given subject about impact smoking for adolescent to video media sent by WhatsApp, and after that followed by a video call and ask the participant the perception, the material of the subject. And the second session, participants were given picture about infant smoking for hot by WhatsApp and asked for their opinion. And the third session, participants were given the task of making heart promotion media through a poster or another video. And the fourth, participant who sent a statement via WhatsApp group and assessment involving the best principal will be given a reward. And
Excuse me, Mrs. Winnie, your time is 5 minutes left.
Okay. And participants share their poster with their friends in social media. Okay, this is the procedure. The result so determine of the participant. Yeah, his age was 60 to 80 years, and there was no significant difference between two groups. And for the smoking behavior, there is a significant difference. The intervention group with a p-value 0.0 and the control group with p-value 0.77 is no different or no significant. And we found significant between two groups. Yeah. This is self-efficacy. I think self-efficacy is same with smoking behavior. We found significant difference between two groups. Okay. In the end, we found the adolescent. I'm sorry. Adolescent empowerment can be development to overcome smoking adolescent by utilizing technology such as social media. And this is the document our research by video call, WhatsApp, and Google Meet, and then WhatsApp group chat. And this is social media or poster by participant. Is example poster. Thank you. That's all for me. Thank you for attention. Okay, I think my time is.
All right. Thank you very much, Mrs. Winnie, for your great presentation. And I love this topic. All right, that actually we will have a discussion after we hear the second presenter. So for you guys, the participant, you can give your question at the Q&A chat, and we will choose 3 of you to ask our speaker. Thank you very much one more time for Mrs. Winnie for your presentation.
Yes,
now,
and for the next speaker, next speaker, we still have another from UK, Mr. Agi.
Yes, correctly. Now we have Mr. Theodore. Hello, Mr. Theodore. Hello, Mr.
Hello.
Yes, thank you very much for join with us in the international conference today.
You're very welcome.
Yes, it's very nice to have you. You will share your expertise about the invisible epidemic, neglected chronic disease management during COVID-19, because now we are still in the pandemic era, right? Well, before you present, my partner, Miss Henny, will read your CV first. Please, Miss Henny, you can read it.
Yes, thank you, Mr. Agi. Hello, Dr. Theodore. Let me briefly introduce you to all participants. The full name is Theodore Stickley, PhD MA. He is from Division of Nursing in University of Nottingham, UK. And his professional experiences, he has staffed mental health nursing for nearly 2 decades at the University of Nottingham and now hold on honorary position. And having taken early retirement, he continued with some private academic work, examined PhDs, and volunteered as befriender to people seeking asylum and refugees. Yes, and without further ado, please welcome Dr. Theodore.
Thank you very much, Ms. Henny. I'd like to remind you, Mr. Theodore, that your time is 30 minutes for presentation. And after that, we will have discussion session. Thank you, and time is yours.
Okay. Good. So you'll operate my PowerPoint for me. Thank you very much. One thing my CV didn't include is that I'm a deputy editor of a public health journal called Perspectives in Public Health, from the belonging to the Royal Society for Public Health here in the UK. And I'm very, very interested in public mental health, having been a mental health nurse for many years and taught at the University of Nottingham. I've taught many, many nurses over the years. Now, obviously, the pandemic has brought many, many mental health needs to life in the world. This has been a great disaster, a great tragedy for many people and for many societies. And if we could have the next slide, please. Before the pandemic, certainly in the developed world, the elderly, the older population, was often seen as a problem created by the increasing needs of the older population. And what I'd like to do is to consider those needs of the older population, both pre and post pandemic. The next slide, please. One of the greatest problems older people face today, certainly in Western societies, is loneliness and isolation. And this is difficult to generalize because in many communities and in many societies, older people are honored and are part of an extended family and are looked after by the family. But in many societies, older people find themselves lonely and isolated. Next slide, please. And with that long life and loneliness, there exists increasing health needs. And what I would like us to consider in my talk this morning is the potential for creative public health approaches older people. Next slide, please. Should we perceive older people as a burden, or should we celebrate the wonderful contribution they make to society? If so, what can we do to achieve sustainable development in healthcare for older people? And so I'm asking this question: how can we prevent ill health in older people? And when I'm talking about ill health, I'm not just talking about the visible diseases, the diagnosable diseases, but I'm also talking about well-being. If people feel well within themselves, there is much evidence that this reduces ill health, and especially mental ill health. So let's look at the World Health Organization definition of mental health. A state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. And this is the kind of definition that I would like us to base our thinking on this morning. Well-being improves our lives, especially the lives of older people. Feeling good about oneself and functioning well in the daily activities of living and in socializing. I'd like to introduce a framework that was developed by the New Economics Foundation a few years ago, and it's called the 5 Ways to Well-being. Now, these can rightly apply to each of us, but especially to older people. And the New Economics Foundation synthesized all the well-being and health literature from a psychological and economic perspective. And they sought to synthesize the key activities in life that keep people well. So let's consider these 5 briefly as a summary of this literature for keeping people well. First of all, the need to connect with others, to talk with others, to listen to others, to be there with others, and to have that feeling of a connection with other people. And this was the first of the 5 ways to well-being, to have social connections. The second way is to be able to give. This isn't just about money, although it might be about money, but it's also about giving your time for other people, or giving your time to a charitable organization, for example, but also giving of your words to others, and giving your presence to other people and perhaps organizations. So first of all, connecting with others, but secondly, giving to others. The third is to take notice of the world around us, and to remember the simple things that give you joy. Maybe it's scenery of nature, maybe it's wildlife, maybe it's simply the garden, or if we live in a city, then perhaps the architecture or the way other people behave. There is much in this world of which we can take notice. Fourthly, keep learning. Embrace new experiences, see opportunities, and surprise yourself. I'm sure that we're all aware of the need for us all to keep learning through life. And finally, to be active, to do what you can, enjoy what you do, and move your mood. Hopefully, we can all relate to these 5 ways to well-being. But let's think about how relevant these 5 ways to well-being are for older people who can often be and withdrawn. Each of these are ways to help older people feel better about themselves. And for many older people, they will need to rebuild their lives following the trauma of the pandemic. But I would suggest that these 5 ways to well-being are a good framework for health and public health of older people within communities. Next slide, please. Well-being improves lives. When practiced regularly, the 5 ways to well-being build resilience, boost well-being, and offer some protection from developing physical and mental health problems. Now, what I would like us to consider is how creative approaches can prevent ill health in older people. One theory that has greatly influenced my work over the decades has been the salutogenic approach developed by Aaron Antonovsky. I'm sad to say that the original literature that Antonovsky developed is very hard to acquire these days. But still, there are many theorists, academics, and practitioners around the world who honor the work of Antonovsky. So his salutogenic approach is one that focuses on factors that support human health and well-being rather than on factors. So a salutogenic approach seeks to identify factors that support individuals in their social groups and in wider communities, and ultimately society, that can help support human health and well-being. And a salutogenic approach in public health identifies people's strengths. And I think there is no better way to harness people's strengths than to adopt a creative approach to public health. Next slide, please. So I'd like to just give some, obviously, within the time allotted, I can only hint at some of the evidence for creative approaches with older people. And I'd like to consider is singing. And this is just one example of a randomized controlled trial. The study was published in 2015, called the Silver Song Club. In 2012, a randomized controlled trial was conducted to explore the effects of community singing. 5 new singing groups were set up, and volunteers aged over 60 were randomly assigned to one of these groups or to a non-singing group. Participants in the singing groups took part in a 12-week program compared to the control group. The singers reported significantly improved quality of life and lower anxiety and depression. And another example, in a large-scale survey of choral singers in England, Austria, and Germany, the majority of participants endorsed the idea that singing enhanced their well-being. Now, often well-being is not measurable. So we, in this kind of research, depend on the views and perceptions and the judgment of the individuals involved.
Sing, sing together, merrily, merrily sing. Sing, sing together, merrily, merrily sing. Sing, sing together.
I just feel free, and I just do things as other people are doing around me. You know.
And it's very therapeutic, and I find it so helpful.
Singing for the brain is a combination of things, really. It's not just the singing, it's all the attributes of singing. It's the breathing, it's the relaxing, the articulation.
When David was diagnosed as having dementia, they sent out booklets with all the stuff in it and advertised this singing for the brain, and I thought, no, it's not for us, because David's not a social person. So eventually we decided to have a go, and we've been coming ever since.
We always meet socially for coffee firsthand, which is really very, very nice. We catch up with people, they can just relax.
Always say hello and have a little few words, see how they're getting on with their problems, because everybody's got a problem.
Perhaps the first time they come, they look a bit bewildered and don't want to join in. But after a while, you can see them, some of them singing, most of them moving and clearly taking part.
We always have a welcome song, which I think is very important, where we actually all sing to individuals and call them by their name, and we often get a very good response from people with lots of eye contact.
Some of those who are being cared for, I seem to notice that is one of the occasions when their name is actually mentioned to them. They say, "Hello, David," and David's face lights up, and I wouldn't be a bit surprised at one of the few times in a week when his name is called to him.
I've had carers come to say that actually conversations have started again at home because, one, the person has got used to using their voice again. I've had people who have come up to speak to me at the end who perhaps their carers have said they don't normally chat to other people. Great friendships have been made.
Singing is special. Not only the singing though, but the actions. And I do things on a Friday morning that I don't do anywhere else.
I think movement's very important. It helps with the words often. We put in movements that are relevant to the words to assist people if they're new songs. And then we choose a variety of songs for lots of different purposes. Some will be to evoke memories. Some are nice simple songs that we can make beautiful harmonies with rounds. Some of the harmonies the resonances have a wonderful effect on people. Jim, for instance, had what I call an R moment. Clearly we were singing a chord that he just adored, and he literally put his hands up and it was wonderful.
Oh, the one I like best is the last one, that Alloway, Alloway.
Alloway, that's right.
Yeah, I put myself to sleep many a time listening to myself singing that, because it's soothing.
Friday morning is so important to us. Not much stops a session. The snow stopped us, but that was about it.
It's a wonderful experience to come every Friday morning. In fact, it's could be said to be the highlight of the week.
As well as singing, I would also like us to consider dance. And as a way of falls prevention, older people have been engaged with dance. For example, during 2015, in 3 dance courses over 10 consecutive weeks, each comprising twice weekly sessions of 90 minutes, led by specially trained dance artists, there was an 85% adherence rate for those who took part in the project, compared to a 40% for standard NHS falls prevention courses. Next slide, please. And benefits attributed to the dance program included reduction of pain, easing of joint stiffness, increased energy levels, better balance and coordination, and feeling more relaxed. Dancing in time thus moderated the physical and psychological risk factors for falls. Next slide, please. Next slide, please. And for visual arts, a 2014 study of post-retirement adults found that, as compared to a group engaged in art appreciation, participants who actively produce art over 10 weeks showed greater functional connectivity in the brain, which was related to stress reduction and psychological resilience. Can we skip this one, please?
When you try your best, but you don't succeed. When you get what you want, but not what you need. When you feel so tired that you can't sleep. Stuck in reverse. And tears come streaming down your face when you lose something you can't replace.
Okay, that was just to give you a flavour of some of the things that can be achieved with working creatively with older people. And you can see how the arts can help people to connect with others, to give of their time, to take notice, to keep learning, and to be active. So there are strong arguments for the arts and creative approaches to be used with older people in well-being and the prevention of ill health. In June this year, we delivered the 3rd International Conference for the Culture and Health and Wellbeing. And over 500 people attended from all around the world. And this was the 3rd of these international conferences. And the reason I'm flagging this up is because
Mr. Theo,
yeah,
your time is 5 minutes left.
Thank you very much. There is a great beginning over the last 10 and 15 years of the development of culture and health and well-being being brought together for creative approaches. And the next slide, please. These are a number of academic journals that now exist to support the arts and health and the arts for well-being. The International Journal of Arts and Health, Journal of Applied Arts and Health, and I've put Perspectives in Public Health there. That's the journal I'm the deputy editor for. But also there's a new one, the Nordic Journal of Arts, Culture and Health. And there are many others. And there are now literally thousands of research articles supporting the arts and health. Next slide. There are books. These are just 2 books that I've edited on the arts and health and the arts and mental health. Next slide, please. Further books, other people edited and written, all promoting health and well-being through music and the arts. And next slide, please. Further books. And I would like to assert that engagement in the arts and culture can keep us all well during and post-pandemic. And I think that's my time.
Yeah, thank you, Dr. Theodore.
Yeah, thank you very much for your nice presentation. I love the movie, the video that I feel like I'm in the UK and then join with that community for singing. All right, we already have and heard the presentation from Dr. Theo, and now we move to discussion session. Well, do we have a question from the participant, Miss Henny?
Yes, we have a question for Mrs. Winnie Hadiani and also for Dr. Theodore.
All right.
Okay, I will read one for Mrs. Winnie. This is from Nadia. Good morning, good afternoon, Mrs. Winnie. I have a question about youth empowerment program for smoking prevention during a pandemic. How long does it take for adolescents to raise critical awareness of risky behavior among adolescents? Thank you.
All right, thank you very much. Please, Mrs. Winnie, you can answer it.
Okay, pardon me.
Yeah. Yeah.
Okay.
Iya,
Miss Winnie.
Bu Winnie.
You can repeat your questionnaire.
Okay, Miss Henny, you can repeat the question for Mrs.
Okay, I will repeat it. How long does it take for adolescents to raise their critical awareness of risky behavior among adolescents?
Oh, okay. Thank you. I think the adolescent is a unique phase, and everybody and everyone in adolescent have to another time, I think. But if adolescent that can awareness about empowerment, they can is motivate to aware the risk behavior. Is always we can remember the adolescent. Always remember. I think that's my answer.
Yeah, okay. Thank you, Mrs. Winnie Hadiani. Mr. Agi, we also have one question. Actually, have two questions for Dr. Theodore, but I will read one first for Dr. Theodore. This is a question for you from Riana Nur Zahid. From Semarang. Semarang, this is from Indonesia. I'm primary nurse. We in a dilemma. One, we should be able to use digital health technology in future life, but in another side, there are not all of older people able to use it. So which way should we use so as they still can reach those digital health technology?
Yes, this is happening in Indonesia, right? So it's difficult for us to implement the technology among the older people. Yes.
Yes.
Yeah.
Yes, I understand. And in many respects, here in the UK, we are very fortunate compared with many societies. So, for example, I've just finished evaluating a creative writing group. And of course, when the pandemic began, this creative writing group for older people had to stop because it was working in the community. But here in the UK, because the majority of households have digital technology, we were able to run this program from people's homes using Zoom platform. And so obviously my presentation is on creative approaches, and it's quite possible to deliver creative approaches through digital technologies. And the problem in countries less fortunate that have not got the resources, this is a great challenge. And you know, other than economics, what can I say? I think what we need is creative ideas to argue for increased resources.
All right, thank you very much, Dr. Theo, for your answer. It's very, very nice. And actually, we also have question from the participant and addressed to Mrs. Winnie. Can I read it, Miss Henny?
Yes.
Yeah. So the question is come from Ian Riani from Universitas Pajajaran, and the question is, this question addressed to Mrs. Winnie. Many result in risk smoking behavior. So what are the nursing intervention to decrease the smoking behavior? Yeah, this is a very, very challenging problem that we can do for the adolescent, right? Because smoking is like one habit among adolescent.
Yes. Waalaikumsalam warahmatullahi wabarakatuh. Yes, I agree that there are a lot of research on smoking.
Yeah.
The main priority in nursing intervention, of course, for the prevention and reduction the number of smokers, especially in adolescents. In our research, we increase the empowerment of adolescents so that adolescents are involved in health promotion, so that they are not only for themselves, but also able to contribute to other adolescents. To their peer group, the promoting health. The empowerment is adolescent share the health promoting to other friends maybe. That is my intervention nursing.
All right, thank you very much, Mrs. Winnie, for your answer. And one more question addressed to Dr. Theo. Doctor, this question comes from Andre. Andre is a nursing student from STIKEP PPNI College of Nursing, and who would like to know the tips for nursing student. So could you give the tip for nursing student about caring for the elderly people with different character and mentally in gerontological people?
Yes, of course. Now, I'm assuming that you're very, very professional in your nursing practice.
Yeah.
But following my presentation, you know, how can you bring joy to this person? And sometimes this is very simple. For me, I would sing a gentle traditional song, and maybe this person will recognize this song and smile, and it will bring joy to their heart. Or maybe if you know traditional poetry, bring something of the person's culture to your care. And creativity, whether it's a song or a poem, but also remember the 5 ways to well-being. And I know in nursing, we can be very busy, but give of your time when you are permitted to do so. And I believe in nursing older people, we should nurse professionally, but from the heart. And this is my message.
Thank you very much, Dr. Theo, for your great answer regarding the tips. So, Andre, you already get the tips from Dr. Theo, right? Well, actually, we have many questions, but we have a limitation time as well. So I apologize to the participant who give the question, but we cannot answer it one by one. But the committee will help you to send the question to the speaker, and when the committee get the answer from the speaker, the committee will deliver to you for the answer. All right, before I give this session, I mean the time to MCs, may I conclude this plenary session of the last session? We already heard about empowerment of adolescents during pandemic 19 from Mrs. Winnie. So I have a note that the component for empowerment, including promoting realization, access, and use of asset, and also some study relate to self-efficacy among adolescents. So the self-efficacy in adolescents is very important as well when we empower them for smoking cessation. And from Dr. Theo, you already heard the knowledgeable knowledge and experience about rethinking public mental health. I interested about the 5 ways of well-being. So the first, connect and give, take notice, keep learning. Like today, all of us keep learning each other to gain our knowledge, our experience during pandemics happening. And also the last one is be active. Like our participant who asks the speaker, they are very, very active. All right, thank you very much for your valuable and knowledgeable experience, and then your presentation, Mrs. Weni, and also Dr. Theo. On behalf of the committee of this international conference, thank you very much. Well, Ms. Henny, now time is up for the plenary session, the last plenary session today, and maybe we can give the time to the MCs to continue the agenda of international conference. I'm Agianto,
and I'm Henny Purnama from Stikap PPNI Jawa Barat.
Thank you very much for your joining us in international conference. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much for Mr. Agianto and Ms. Henny Purnama with light fruitful third plenary session. Ladies and gentlemen, before we jump to the next agenda, we will show you a company profile video from co-host Stikas Dirgahayu Samarinda, Universitas Muhammadiyah Jakarta, and Stikas Muhammadiyah Ciamis. Please enjoy and thank you. Keep stay with us.
Good morning and warm welcome to all participants. We are from Stikas Dirgahayu Samarinda, so proud to join with Stikap PPNI West Java, among other universities, to arrange the 4th International Virtual Conference in Nursing. Stikas Dirgahayu Samarinda is one of School of Health and Sciences located at Pasundan Street number 21, Samarinda East, Kalimantan. For now, our school has 2 programs, Bachelor Degree of Pharmacy and Diploma of Nursing. We welcome all the participants from all over the country and also from other countries who are willing to join and to share their knowledge and experience in this event. Through this event, let us do sharing and caring so our nursing world will more advance in the future. Once again, to all participants, welcome to the 4th International Virtual Conference in Nursing. Salam Caritas et Fraternitas, salam kasih dan persaudaraan.
Keuskupan Agung Samarinda memiliki karya kesehatan dan karya pendidikan yang saling bersinergi. Yayasan Setia Budi Samarinda didaulat untuk mengelola institusi pendidikan yang berkembang pada saat itu. Sekolah Perawat Kesehatan Dirgahayu dibentuk karena kebutuhan Rumah Sakit Dirgahayu akan tenaga perawat. SPK Dirgahayu berdiri pada tahun 1983. Berubah bentuk menjadi Sekolah Tinggi Ilmu Kesehatan atau Stikes Dirgahayu Samarinda bulan November 2017 dengan 2 program studi, diantaranya Diploma 3 Keperawatan dan Sarjana. Stikes Dirgahayu Samarinda memiliki 3 bangunan yang terdiri dari Gedung Santa Ursula, Santo Benedictus, dan Santa Maria. Di Gedung Santa Ursula terdapat ruang dosen, ruang pimpinan, ruang akademik, ruang TU, ruang UPM, ruang UPPM, ruang Kaprodi, ruang kuliah. Laboratorium keperawatan yang terdiri dari laboratorium keperawatan gawat darurat, keperawatan maternitas, dan keperawatan medikal bedah. Dan laboratorium komputer. Keperawatan anak, dan laboratorium biomedik. Terdapat laboratorium farmasi, perpustakaan. Stiktak Person. Alamat di Jalan Pasundan nomor 21 Samarinda, Kalimantan Timur.
Persaingan global dunia keperawatan menuntut pelaku profesi untuk melakukan penyempurnaan asuhan keperawatan di tengah masyarakat. Fakultas Ilmu Keperawatan Universitas Muhammadiyah Jakarta mampu menjawab tantangan tersebut untuk mencetak generasi keperawatan yang profesional, memiliki integritas iman dan takwa, berilmu pengetahuan, serta berakhlakul karimah. Di masa studinya, mahasiswa ditempa dengan disiplin ilmu asuhan keperawatan dan dididik untuk menjadi perawat profesional yang memiliki sikap tanggap, peduli, cekatan, teliti, dan berakhlakul karimah dengan menggunakan kurikulum yang mengacu pada kerangka kualifikasi nasional Indonesia di bawah supervisi dari akademisi, praktisi yang bergelar master, spesialis, dan doktor.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ahmad Firdaus Cook, and I want to talk to you today about the nursing facilities of University Muhammadiyah Jakarta. They are clean, bright, and the facilities are well defined. The staff is always very helpful to newcomers, visitors, and teachers. The building structure is handicap friendly, having an elevator which is well maintained. In the beginning, students are quite energetic and active, but very shy to freely speak English. After a few semesters, their shyness is reduced, and they begin to feel more confident to interact with common speech, such as, "Hello, what's your name?" or "Hello, how are you?" This campus has many credits, 16 in fact, that facilitates the students to be competitive on an international and global level with English 1 through English 8. This is due to extracurricular activities. The school's English programs are competitively engaged with other campuses to improve capabilities on that international level. Many students go on to classes internationally and easily go on to their internships with upper grade hospitals such as Rumah Sakit Islam Jakarta. And I'm happy to be part of the development of the Indonesian nursing profession.
Assalamualaikum warahmatullahi wabarakatuh. Saya pimpinan Stikes Muhammadiyah Ciamis dengan bangga memperkenalkan Stikes Muhammadiyah Ciamis dan saat ini alhamdulillah telah menjadi Sekolah Tinggi Ilmu Kesehatan Muhammadiyah Ciamis yang telah dilaksanakan akreditasi baik BAN PT maupun LAM PTKes dengan nilai akreditasi B.
Perkuliahan di Stikes Muhammadiyah Ciamis didukung oleh dosen yang kompeten dan kurikulum yang unggul dan islami, terintegrasi dengan kegiatan penelitian dan pengabdian masyarakat.
Stikes Muhammadiyah Ciamis dilengkapi dengan sarana prasarana yang sangat baik dan menunjang, dan dilengkapi dengan sistem informasi yang terintegrasi.
Lulusan Stikes Muhammadiyah Ciamis tersebar di instansi swasta maupun instansi pemerintah, baik di dalam negeri maupun di luar negeri. Mari bergabung bersama kami di Stikes Muhammadiyah Ciamis, kampus ilmu kesehatan yang profesional dan berkarakter.
Ladies and gentlemen, all the plenary has been completed. But before, there will be several announcements. For the first announcement, there will be an explanation about oral presentation by Mrs. Linlin Lindayani. Mrs. Linlin, time and place is yours.
Ya, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat siang Bapak Ibu yang terhormat yang sudah berkenan hadir untuk menghadiri event internasional rutin secara tahun yang diselenggarakan oleh Sekolah Tinggi Ilmu Keperawatan PPNI Jawa Barat. Izinkan saya menyampaikan beberapa pengumuman terutama untuk peserta yang besok mengikuti kegiatan oral presentation. Ya, kegiatan oral presentasi bagi Bapak Ibu yang sudah daftar itu akan dilaksanakan pada tanggal 9 September 2021 pukul 9 waktu Indonesia Barat. Nanti Bapak Ibu peserta oral diharapkan sudah hadir di Zoom pukul 9 sesuai dengan link Zoom yang sudah dibagikan oleh panitia. Waktu presentasi itu 7 menit. Jadi mohon Bapak Ibu sudah mengecek dari sekarang PowerPoint-nya bahwa presentasi dibatasi hanya 7 menit. Jadi jika dalam kurun waktu 7 menit belum selesai, mohon maaf jika nanti panitia terpaksa harus men-stop presentasi Bapak Ibu dikarenakan jumlah peserta yang ikut di oral presentasi kita lebih dari 100 peserta. Jadi waktunya sangat terbatas. Kemudian setelah oral presentasi dilaksanakan oleh Bapak Ibu selama 7 menit, Bapak Ibu nanti akan langsung masuk ke dalam sesi tanya jawab yang akan dilaksanakan bersama dengan reviewer sesuai dengan bidangnya masing-masing. Sesi tanya jawab itu akan dilaksanakan selama 3 menit. Ya. Jadi nanti total waktu presentasi Bapak Ibu itu akan dilaksanakan selama 10 menit kurang lebih. Setelah presentasi, dimohon Bapak Ibu untuk tetap join di Zoom-nya masing-masing. Karena di akhir dari presentasi akan langsung diumumkan the best oral presenter. Jadi peserta terbaik untuk oral presentasi akan langsung diumumkan di dalam Zoom room-nya masing-masing untuk setiap bidang keahlian keperawatan. Jadi Bapak Ibu memiliki kesempatan yang jauh lebih besar untuk terpilih sebagai oral presenter karena saingannya hanya di dalam bidang atau departemen keahlian di masing-masing sesuai dengan yang sudah dijadwalkan oleh panitia. Berikut adalah pengumuman penting untuk besok. Mohon Bapak Ibu menggunakan virtual background yang sudah kami sediakan dan datang di pukul 9 meskipun jadwal presentasinya pukul 11, tapi semuanya diharapkan dan wajib hadir di pukul 9. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh. Sampai ketemu besok di acara oral presentasi Stiker PPNI Jawa Barat.
Thank you very much, Mrs. Linlin, for the information.
Ladies and gentlemen, for the next announcement, we would like to announce the door prize for the best participant and best poster. For the best participant, there is special door prize for following participant. Rian Adi Pamungkas, Nusa Unggul, Jakarta. Dimas Utomo Hanggoro, Putra, from UGM. Close. Ian Riani, Universitas Pajajaran. Ian Hudiawat, from UNJ. Arianto Nugroho, RFX Aisyah Boyolali. Firman, from Sikap PPNI Jawa Barat. Kedua, from Sikap PPNI Jawa Barat. Yani Nur S. from Semarang. From PPNI Semarang.
And next, I will announce the door prize for the best poster presentation. And for the best poster presentation, the winners is Aulia Rahma, Anissa Nurfadila, Siti Iwati, Ika Ayu Oktaviani, Ika Ayu Saraswati. Congratulations for the winner. Please on the camera. And we would like to take a picture first for the best poster presentation. Okay, I will count to 3. 1, 2, 3.
Okay,
Okay.
congratulations.
Congratulations.
Participant and oral and
Poster presentation, that's right. Okay, ladies and gentlemen, here we are at the end of the conference. We would like to thank you to all of you in joining the 5th International Conference in Nursing 2021, held by Sikap PPNI Jawa Barat in collaboration with Tikes Panakukang Makassar, Tikes Sukabumi, Universitas Lambung Mangkurat Banjarmasin, Poltekkes Karya Husada Yogyakarta, Tikes Muhammadiyah Ciamis, Universitas Muhammadiyah Jakarta, and Tikes Dirgahayu Samarinda. Last but not least, we would like to extend once again our deepest appreciation to the distinguished guests, speakers, moderators, and the audience for your support in participating the 5th International Conference in Nursing, Sikap PPNI Jawa Barat. On behalf of the committee, I am Gilang Dwi Pratiwi.
And I am Masdum Ibrahim. We wish you have a wonderful day. See you in the next event and course of in better situation. Once again, thank you very much. Stay safe and
Thank you
healthy.
very much. Wassalamualaikum warahmatullahi wabarakatuh.
See you.
See you in 2022.
Okay, thank you for all. Hatur nuhun.
Thank you.
Sampai bertemu
Syeshe.
kembali tahun depan.
See you next year. Yes.
Semoga kita panjang usia, tetap sehat dan bahagia.
Amin.
Hatur nuhun.
Hatur nuhun.